Centre, how can I help?
Feels like it's in my back most of the time.
Right.
Sorry, Craig's killing me.
Oh, dear. How many did you used to smoke a day?
30 to 50.
30 to 50
Yeah, when I was
a day.
smoking, yeah.
The right side of my skull is changing continuously. Hurts like hell. Touch it and I scream sometimes.
Each day I wake up, I think, oh, Jesus Christ, another day.
I don't like the look of the colour of that.
I don't like the sound of the pain either.
Oh, look at that sun coming out.
No, it's lovely, isn't it?
It's supposed to be all right, isn't it, now, the rest of the week?
It's supposed to be, isn't it? Yeah.
Hello.
Alex Slater.
Wrong end.
Come on this way. Well then, come on in. Come and have a seat. Hi.
I have some boils.
Right, OK.
Troubling me for some weeks now. I've tried putting magnesium sulfate onto them to bring them to the surface, but nothing's really
How long
helped.
have you had those for?
They've been going on and off now for a couple of years.
Have they?
Yeah,
Okay.
I had a 7-headed one, what, 3.5, 4 years ago,
Yeah.
on the bottom. That was very sore.
Yeah.
So that ended up having to be lanced. But I just seem to keep getting them. It's small when I shave.
OK.
And it's not sore when I shave, it's normal, but...
But then you get boils afterwards.
yeah,
Sounds like you've got an infection there. Should we have a look at it?
No,
Or is it?
that's
Is
fine.
it?
That's
is
fine. It's
Yeah.
Yeah.
But you're all right if we...
yeah, no, it's fine. Okay.
Can I come in?
Yes. Sorry.
All right, gosh.
What's brought you here today?
JJ has a temperature and he has a cough and he can't really speak very well because he's got a very croaky throat, as you can hear. He had a temperature about a week ago and it's been on and off ever since, hasn't completely gone away. I've been giving him Calpol, Nurofen, lots of water. He's been off his food and I just thought before the weekend comes, I need to get him seen to you.
OK, so his symptoms have been for about a week with the cough.
And the temperature, yeah.
Has it worsened, his voice worsened?
Yeah.
Is he coughing anything out?
No.
Right. Shall we look at you?
Should you take your jacket off today? Sounds like a little monster. Where does it hurt? Tell the doctor where it hurts.
I just need a little feel. Well done. Let's have a listen to your chest a moment. OK, so his chest sounds clear. Can we pop that on your finger?
Oh, nice.
Oh, you're going to do it. Well done. That's it. You
JJ.
keep it nice and still there and look at the
Watch
numbers
the
when
numbers,
they come
yeah?
up.
What's your
And
favourite
keep
number,
your
JJ?
head still.
What's your favourite number
it
3?
nice
Is
and
that how old
still.
you are? What's your favourite number, Josh?
29.
That's a very unique number.
Can I have a little look in your mouth?
Just wide as you can. Just wide as. They did it.
As wide as you can. Good boy. Nice and...
The height of me too.
I can't see any pus there. It sounds like he's had a viral infection, so there's inflammation within the vocal cords.
Right.
Let's just pop this one in your ear. It's not going to hurt, sweetie.
She's not going to shoot your ear.
Well done.
You're so funny, Josh. You're supposed to be calming him down.
That's fine, that's all normal. If after the weekend you're finding that he's not any better or he's worsening, then bring him back and we can review him.
So you don't
Or
think he
if
needs
he
antibiotics
changes.
then?
Antibiotics won't treat a viral infection.
No. All right then. Come on then, JJ. Let's put your jacket on. OK, come on then, boys. Oh, careful, Jay.
Well done.
Hold
Yeah,
on.
I'm much stronger than you. I can open that easy, please.
Well done.
Oh, careful.
I can
Thank
run
you.
out.
Bye. Bye.
They're going all the way down and then
But they're always just on the outside. They're not actually inside your bits.
they've been going down that way, yes. And I have some. I've had a few on my bottom as well. Oh, but they're so painful.
Yeah, I can see that they are. That's fine. Do get yourself dressed up and come on out. OK, so those infections, those are little boils, as you say.
They are boils, aren't they?
Yeah, and
Okay.
they essentially what's happened is when you shave,
Yep.
the
Hair follicle goes down instead of up.
and you get a little bit of infection around the base of the hair follicle.
Why
And
do they not want to come out?
Well, it's because of the shaving that sometimes then you get a tiny bit of skin growth over it, and it just means that it can trap some of the bugs in the hair follicle, and so it happens more commonly when you shave.
Right.
What we need to do is to try and reduce the amount of bacteria down there.
Right. What causes bacteria down there?
Well, it's actually we're all covered in bacteria all over our skin,
Right.
everywhere. Some wash just to help reduce the bacteria there.
Dermal when I wash.
Well, I'm going to try something that's a little different from that, just to see whether that helps settle it down. The other thing to do is just think about not shaving there, because obviously that will reduce the chance that you get the infection
There is
But
that point.
And if you're getting other infections, or you're getting this as an ongoing thing, should we be doing any other tests? It's not unreasonable to check your blood test, as I say, and then we'll see what's happened when we've got the tests. You don't get any under your armpits or anywhere else?
No, I use a different type of razor. I use Bic for there and electric for there.
OK. Blood test you can book in as well, and then I'll see you with the result.
Okay.
All right?
Yeah.
All right. Cheers then.
Thanks, Dr. Kelly.
Bye-bye.
Bye, darling.
3 trips for older people.
Where are we going?
I don't know. I'm just part of the Bristol Aging Better project, offering older people the chance to benefit from day trips.
What are you looking at that for, Jackie?
Well, because I'm an older person, yeah. We're trying to work out where we're going.
Come in, I'm Dr. Gosh. Come and sit down.
Thanks. I'm having problems sleeping. I got this thing where when I get up in the morning, as soon as I wake up, I feel so sick. And I got to get out of the bed because I think something bad's going to happen if I stay there.
Right.
And this has been happening for quite a while.
Okay.
So I've been treated for depression.
Yeah, I saw that, yeah.
But now I'm not even going to bed, I'm just sleeping in the chair.
Oh dear. So what exactly happens when you try and go to bed? Do you get to sleep to start with?
No, as soon as my bum hits the bed,
Right.
I feel sick.
But what are you sort of worried about? What do you feel like?
I just think if I stay there and try and go back to sleep, I think something terrible's going to happen. I'm the eldest of 11 children.
All right.
But I've had 3 siblings much younger than me die in the last 3 years.
Right.
And I'm a widow. I've been a widow now 26 years. And it gets harder.
I'm sure it does.
People say, oh, time's a great healer. It's not.
Still very lonely, isn't it, for you?
I've wanted to die for the last 26 years.
Have you?
There's a bit of wear and tear there.
It's old age.
It's not old age.
I've tended to slow down.
No.
Playing football.
Getting old now, 92.
You're looking very good on it.
Oh, I don't know about that.
You look from this terribly fit and healthy.
Yeah, I am terribly fit and healthy.
God, are you really 92?
I am, sweetheart.
You look fantastic.
Thank you. 93 in September. Actually.
Whoa, that's fantastic.
I would not do something to promote my own death, because I would not want my children to go through what I went through.
Yeah, sure.
That is the only thing that stops me.
Sure.
So
Sure.
each day I wake up, I think, oh, Jesus Christ, another day. You're here whether you want to be here or not.
Yeah, sure.
Must be a reason for it.
Well, there must be a reason for it, mustn't there?
Yeah. Just bug a lot of people on the way.
What do you think would help with all of this? I see you've tried some antidepressants in the past, haven't you?
I did, and oh God, they made me so bad.
You didn't really get on with them at all, did you? I mean, it sounds to me, there are a lot of groups that can help people who've been feeling down or struggling a bit.
Yeah.
And if you're the sort of person, particularly who is quite sociable by nature, you might really find that helpful. Would you like to give that a go?
I don't think so.
You wouldn't?
I'm not ready for the lunch with the old people. No.
The other thing is, have you met Heather, who's one of the receptionists here?
she got me, and I was going to do some voluntary work.
Yeah. Can I ask Heather to give you a ring again and
You can.
see what else she can do? Because I think
there
it's
must be
more.
something I
I
can
think
do.
it's something you need to do, isn't it? Because I think
know
it's
my-
more the social side of things, really.
The falling asleep. I wonder, could I have a blood test to see that I'm not anemic? I've always had it.
Oh no, you did. You had one in March.
Yeah. It would show up if I was...
It was slightly borderline. It was just about all right. Let's check again and make sure you don't need any iron tablets.
Yeah, that's what I'm thinking,
It's just
because
occasionally that
over
can-
the years I have had to go
yeah,
on.
Yeah, and that can give you problems sleeping, definitely. Yeah,
exactly.
Okay, so book in for that, and I'll ask Heather to have a chat with you.
Okay.
Okay.
Oh, sorry you had to get me on.
That's all right.
The sun was shining over the nursery courtyard.
What's a courtyard? A field.
What's a courtyard?
Is it a field?
Courtyard.
Is it like a field?
In the playground.
Yeah, it's like big concrete.
Okay.
Yeah.
You're a new patient here?
Yes, been overseas.
Right. And where have you been?
All over Africa, and the last 3 years was Sri Lanka.
Right. Very nice.
So moving around.
What were you doing?
I'm a minerals person, so I'm scratching around looking for gold and diamonds normally.
Right.
Haven't
You're not
found
from the
enough yet
UK?
because I'm still working. So.
Yeah. And you're not from the UK originally?
No, I am. I'm fully
Are you?
English, but
Right.
not many gold deposits around Bristol or diamonds or a bit of coal in South Wales. Used to be some tin in Cornwall.
Okay.
So
So what have you come for today?
the main one I actually want to come at is I've had a lot of sun.
Yeah.
And my brother had very bad melanoma, stage 4. Very lucky to still be around after 6-7 years.
Right.
And so I've had lots of things burnt off me, taken off me.
Yeah.
I now have this thing on my head, and of course, coming to a doctor, it's the smallest it's been in 7 months.
Right.
It looks a bit weird. It comes and goes. It bleeds a bit.
Right.
It gets bigger, smaller. So I basically wanted someone to look at that.
Okay. All right. So I'm just going to look at it with a bit of light and some magnification. Okay. So it's a raised lump with a little dip in the middle. It is a bit sort of pearly. So there is a small possibility that that is not a malignant melanoma, but a different sort of skin cancer.
And sometimes if I just scratch it the tiniest bit, it'll bleed and run down a fair bit. And
Yeah.
I believe that's not necessarily...
So it's 6 millimetres. I think it'd be reasonable to go and see somebody about that. There's an urgent referral where you'll get seen within 2 weeks.
I'm actually going away right now
Yeah.
for 13 days.
Okay. Right. So
I
they'll
would like to have
see
done it
you-
urgently, but
Yeah.
I took a
Okay.
while
Well,
to
hopefully they'll just see you
after 2 weeks.
after that. Yeah. Have you actually had skin cancers removed?
I've had, I'm never quite sure, carcinomas, basal
Basal cell carcinoma.
basal cell carcinoma. Does that classify as a skin cancer?
Yeah.
It is, isn't it? Yeah. I think I've had 1 or 2 chopped off.
You're going to be in the UK.
No, I'm going to Italy for 13 days,
Right.
basically. I'm actually going to leave now. Our taxi's coming in half an hour.
Right.
45.
Okay. I'll put it at the front desk in an envelope. You can pick it up when you get home, okay, from your holiday. Okay.
Thank you, Doctor.
That's all right. Bye now.
How are you today?
Good, thanks. You?
Yeah, not too bad. The sun's come back out, so I'm happy with the sun.
Oh, good. So you're going to have some time after your shift to play with it?
Well, I'll be home about 7.
Oh.
Does Sally want to sit over there? I was just getting you
Yep.
a seat, sir.
Oh,
Sorry,
thanks.
I don't know your name. So.
Keith.
Keith, hello, Keith. I'm Linda.
Hi, Linda.
And what's your name?
Thanks. This is Lily.
Lily. Hello, Lily. And which side do you want the injection?
Maybe the left, because I'm right-handed. That makes
Okay.
sense. Turn around.
That's fine then. You go that way then, Lily. That's right.
Is that enough room to get
That's
whatever
fine.
you need?
Only want the top of your arm. So I'm giving you a booster of your tetanus. We talked about it on the phone, didn't
Yeah.
we? Tetanus, diphtheria and polio, all in one. Sally came to see me because she needed some travel injections because she is travelling to Chicago in September to compete with the Great Britain blind sailing team.
I said what I was doing, didn't I?
You did, yeah. Wow. Exciting, isn't it?
Yes, I've just got to deal with the training now.
Sally was born with normal vision, but when she was about 6 years old, she contracted an eye condition called uveitis, which has left her with only 5% of vision. Is the training based in Bristol?
Some of it is. So we've just come from the swimming pool, actually, done 30 lengths. And yesterday I was doing some quite evil core fitness training to simulate racing a boat. So pulling a 40-kilo tyre around the gym.
Right, OK.
And then tomorrow I'm off to UK Sailing Academy to train with the Great Britain squad. So we'll be on the boats at sea. So.
Wow. And where's that? Portsmouth or something?
It's Cowes in the Isle of Wight.
Yeah. Nice. And you're going to have nice weather for it as well, so it'll be lovely, wouldn't it?
As long as there's wind, we don't care what else there is. But if it's sunny, that's an extra bonus.
It is, isn't it? I should think so too. So you OK with needles?
Yeah.
Yeah, all right then. I'm just going to pull your sleeve up a little bit there, Sally, all right? Here we go then, sharp sting. There we go, all done.
Great. Is that all right to put down,
All right, that's fine. So that would last, in theory, 10 years.
Great. Thank you for fitting me in so quick, thanks.
OK, it's a gold medal, won't you?
A gold medal. No pressure, no pressure.
No pressure, no pressure. Just a gold medal. OK, nice to meet you.
And you.
Bye-bye,
Thanks, Linda.
You too. Bye-bye.
Bye.
Oh my God, look at these. Oh, these cakes look amazing.
I very rarely eat cake, and so it has to be really good before I bother.
Rarely eat cake.
Well, these are always good when Heather does them.
George Anderson, please. Hello, George.
Hiya.
Sorry to keep you.
That's right, I was late myself, actually.
It's all worked out then.
Yeah.
Come and take a seat. How are you?
Extremely tired. I'm exhausted all the time. I don't know what's going on, but the right side of my skull is changing continuously. It's getting big bumps, big dips, hurts like hell. I have no idea what's going on. I haven't banged it or anything, but it's completely deformed. There's not an inch that is smooth. And it hurts. Touch it and I scream sometimes.
Okay. How long has this been with you for?
Months.
Okay.
It's months. Yeah.
Let's just have a look and see what's going on.
Yeah.
Have you found any bits that are itchy or any particular spots?
But they change continuously. Every day there's a new... And it's not like swelling because it's really hard. It just feels like the skull itself has gone over.
Well, there's nothing to be concerned about in the sense that there's no skin lesions or scalp lesions because some people get cysts or other things or spots or
Oh, no, it's a very
something or
different kind of pain than the cyst.
But,
like.
I mean, it all feels like a normal, it feels normal to me.
Really? And this really gets me, especially in the evening, it starts to hurt. And I'll just brush my head or just touch my head and I'm just like shocked at the amount of pain that there is. And I start touching and I find all these painful spots.
So it might be what we call dysesthesia, or it's an altered sensation.
Yeah.
It's almost perhaps some kind of superficial nerve thing going on. But I think we'll just watch that. George is currently 59. He has quite a few complex medical health problems. He suffers from cluster headaches. He's hepatitis C positive and HIV positive. HIV, if it's caught early, is no longer a death sentence. In fact, people can live a near normal lifespan because there have been significant advances in the medicines used to control the rate of growth of the virus. I'm pleased to say that currently George doesn't suffer from any issues related to his HIV. It's well controlled. However, unfortunately, he has also been under significant stress recently, which has led to anxiety and low mood symptoms.
I didn't take the antidepressants at all.
Okay.
I made a conscious decision that because they take so long to work, and there's certain things that, they basically castrate you. I mean, your sex life just disappears. And that is one of the only things that actually keeps me alive and happy a little bit. And to eliminate that would be just dramatically wrong.
If you're happy not to start that, that's fine.
I need my faculties, and I actually need a little bit of extra emotion to get through something instead of just kind of letting everything just, which is what happens a lot of times.
That's quite a valid point, actually, because sometimes some people can feel a little bit subdued on them.
Yeah.
You're not vomiting? You're not waking up at night with headaches?
Not those headaches, no.
No. And no symptoms on your face or in your jaw or in your mouth?
No. No.
All right. Well, you're going to be due some tests and things when you go to the Brecon unit next week, but maybe we could touch base in 6 weeks or so, and you can keep me posted.
Yeah.
Obviously, if anything bothers you before that,
Yeah,
then
sure.
come in sooner.
Sure. That's it, yeah. Good.
Nice to see you.
Likewise.
Take care.
You too. Enjoy the weather while it lasts.
Laura Smith, please. Morning. All right. Just while I remember, I've got a message on my screen saying, can you go to reception after you've seen me?
Okay, right.
Some message for them to discuss with you.
Yeah, all right, lovely.
Okay.
I'm just happy I got an appointment, to be honest.
Okay, what can I do for you?
So this pain, I've been getting it, my last 2 appointments, I had this spot I've been complaining about. I finally got my ultrasound tomorrow. Which is like a light at the end of the tunnel, but today it's the longest I've had an attack for. It's like, woke me up at like 5 o'clock.
What's the pain like?
Stabbing, I would say. Feels like it's in my back most of the time.
Right, okay.
But then it's also down here. Sorry, Craig's killing me.
Oh, dear.
Sorry.
That's all right.
I don't normally get weepy, but I think it's because I'm not sleeping.
Yeah.
But hence why I made the appointment, because I haven't ever gone 3 hours in that amount of pain. Tramadol isn't doing anything. My mum has been giving it to me since it started.
Right.
But and I'm also concerned, what do I even do once I've had the ultrasound? How do I find out? Because I just want it gone. I don't know what it is.
Okay.
Sorry.
Before I forget all about it and go home with it,
Oh,
there is a pot of my wee for you. I bought you a gift.
I got my sample.
Oh, smashing. Cheers. I'll take that.
Wee-wees.
Yes, it's our wheeze.
I those kind of days, dipsy days.
Is that enough?
Yeah. If you're able to do that in the treatment room, that would be great.
It'd be marvellous. It'd be a miracle. I've just been...
Oh, have you?
So I haven't ever gone 3 hours in that amount of pain. And I don't know what I'm doing to kickstart it. Or... This is what the ultrasound's for, I suppose.
Yeah.
When I was saying I think it's gallstones, and I'm thinking, well, normally food or something kicks that off, and I'm not doing anything to start this pain off, so...
Right. When you get the pain, you use tramadol.
Yeah, but I'm taking tramadol as more of like a prevention.
Right.
Because it's pointless taking it when you're having the attack.
And when you're taking it, how many are you taking?
I'm only taking 2 a day because it keeps making me constipated.
Yeah. I think rather than taking it to try and stop it coming, I think we need to try and take it when it comes.
Really?
Yeah. I just want to have a little look at you. OK, if you jump up on the bed for me to feel your tummy. So have you got the pain now?
I can feel it in my back,
In your back.
but it's more of a niggling. It's not like the agony that I'm getting.
I'll just have a little feel around. OK. It's all there.
Yeah.
Isn't it? Yeah.
Sorry, I tense up.
That's all right. That's fine.
Yeah.
OK. Would you mind just doing a urine sample, just to check we're not missing anything in your kidneys?
Yeah, if I can get anything out.
So if you go and do that now and come straight back in.
Yeah. That's literally all I got, I think.
Yeah, that's fine. That's all I need. OK. Have you got your period at the moment?
No.
No. OK. So there's 2 platelets of blood in here. I don't think it's a urine infection, but I'm going to send it to the lab just to be sure. OK. One of the things that can cause sort of loin pain going through to the back, is kidney stones, and that can cause blood in the urine. OK. So I think what we need to do is wait for this scan tomorrow. Yeah. If it shows gallstones, fine, then we refer you to have it removed.
OK.
If it doesn't show anything, I think we'd then need to consider, do we need to do a CT to look for kidney stones?
Yeah.
In the meantime, I can give you a small supply of tramadol, but like you say, they are very addictive and they do cause constipation.
Yeah.
OK. The other thing I could give you that does work very well for gallstone-type pain is a suppository. So I don't know how you'd cope with that, how you'd feel about it.
No, I'm fine with that.
Good.
But if it's lasting this long, Oh, sorry.
It's all right.
I think I needed a bit of a rant as well.
That's OK.
Yeah. Thank you.
No problem.
Thank you so much.
No problem.
Have a nice day.
You
all
too.
right.
Bye-bye.
Slapped a cyclist.
Oh no!
I stood waiting for my bus and I'm looking up the road and the bus is coming down the road.
And you put your hand out.
And I put my hand out and I went like that.
Ah!
But he was
Did you knock him
coming-
off his bike?
No, he was pushing his bike up the road on the
Hello.
wrong side of the road.
Well, there you go then.
You had a nasty injury, didn't you?
I did. I've just been up to see the consultant. He's just taken the stitches.
OK. It was a bike accident?
Yeah, came off the bike and displaced the shoulder, so they've put it back. I went for a CT scan at the RUH, and that was why I was coming back, really, because they said you might want to go see the GP just to check. Because I told them that I get these really bizarre headaches, but I get a line across my eye, but it's not blurry, it's just a complete blackout of half of my eye. Not two, it's only usually the one, usually the left.
OK, because that's an unusual pattern for a headache or a migraine or anything like that, because normally the headache or a migraine, what you're talking about is a loss of a field of vision, and it will be the same field irrespective of which eye is open.
No, it's not.
How long have you had the headaches for?
This has been going on months and months.
How often do you get them?
Probably 1 or 2 a month.
How long do they last for when you get them?
The intensity lasts about 10 minutes, and then I'll either go to sleep and try and sleep it off, or it tends to just fade off.
Do you feel sick with the headache?
Sometimes a bit
Do you
sick.
actually vomit
No,
or not?
no.
That's migraine, my book. OK,
Yeah,
so a visual warning,
Yeah.
followed by a nasty headache
that's what I
with some
assumed,
nausea. That
Yeah.
sounds like migraine.
Yeah.
OK. So one of the problems with doing CTs of people's heads, and you might do it for one reason,
And find
it
something
finds
else.
something else. We call this the vomit syndrome. Vomit stands for Victim of Medical Imaging Technology.
Okay.
So this might be the vomit
All right,
syndrome,
yeah,
I'm
that's
afraid.
fine.
So this is an important bit. So there's no bleed inside your head. Grey matter and the white matter looks normal in the head, so that's,
Yeah.
the thinking material. Down at the base of the skull, they're saying that there's something that looks a bit funny, and it might be it's a blood vessel that's slightly enlarged, or by lacunar infarcts, they mean a type of stroke.
What are we talking about?
I've had a slightly bad back for a few months. Sort of stiffness, stuff like that. Nothing too major, just, you wake up in the morning and it's always kind of there.
Yeah.
But then a week ago, last Sunday, I played cricket on Saturday, felt fine, and then on Sunday morning I woke up and couldn't tie my own shoes, never mind do much of anything.
Sure.
And it's been like that for about a week now.
So you've had the stiffness in the back for the last 6 months or so?
Yeah, I think it's a long-standing, 6'3", lanky, don't sit in chairs properly, bad posture all my life and all that kind of stuff, and it's just finally caught up with me. And then I changed jobs last year, and I think I just didn't have a very good setup at work. The wrong chair and this, that and the other for a few months, and it's just kind of brought everything to the surface a little bit.
But the stiffness is different from pain, or...?
This feels different. It feels like an injury, like a muscle tweak or something.
Sure. And let me just double-check, the pain's just in the back, it's not radiating into the legs?
No, it's all lower back. The general stiffness I've had from a few months tends to be lower back, but depending on how I sleep and stuff, it can be a bad neck and other things.
Let's just lift this leg up. No weakness or numbness or tingling?
No, not that.
And peeing and pooing normally? Just checking the nerves are all OK. Stand up for me. I'm just going to press all here, if that's all right. Is it sore in the sides?
It's not sensitive to touch or anything like that.
Is it sore in there at all?
No.
Just touch your toes for me.
Not a chance.
Are you quite inflexible?
I'm fairly inflexible anyway, so there's no chance I'd be able to
stay sideways and just
my toes, but
just
quite
bend.
Whereas I get to about there and it starts to hurt, and if I go much further, it's going to.
Would that be your normal range of movement? Do you think?
No, it's a little bit. Well, I'm somewhat inflexible anyway, I have to admit.
Sure. And in terms of, I'm just looking at your medicines, you're not on anything regularly?
No, I've been taking ibuprofen for a few days.
Yeah. Well, do you want me to give you some stronger anti-inflammatories then?
That might be worth trying.
OK, well, let's try that. I think that it is likely that you've just tweaked it. There's no worrying signs of it being affecting the nerves, which is the medical worry for back pain, so I can just reassure you that it should all just settle down. So that's what's happened just in the last week. In terms of the last 6 months, though, I'm hearing that it may be that this is a stiffness problem and that there may be some underlying issue there. Now, there is a condition of stiffness in the morning that affects young men and causes back pain.
Okay.
And I think if you've been having that, then it would be a reasonable thing for us to check a blood test and an X-ray.
By all means, yeah.
The condition is called ankylosing spondylitis. which is an inflammation problem, and that's the thing that we just need to make sure that isn't there.
Okay.
And, you know, it's quite likely that that's not going to be the case, but I'd just like to make sure that we get the blood test and the X-ray, and then get you back in to see your own doctor with the results of those tests in a few weeks' time.
Yeah.
All right? If any other problems in the meantime, then let us know, but I think it will all just settle down with that plan.
Okay, great. Okay, great.
Cheers. Hope it settles down.
Cheers. Bye.
I would be astonished if you'd had stroke, really. I mean, it seems really unlikely. You're very young, you're very fit, you're very healthy. There's no reason why that should have happened. What we do need to do, having got that report, is just do a quick neurological examination and get blood tests and check your blood pressure to make sure you've got no risk factors for developing a stroke. Okay?
Yep.
Let's do the blood pressure first, actually. Is this all making sense?
Yeah.
Let's put it round here. Yeah, okay. Have you been back on your bike since?
No, I did ask, and he said, "I prefer you not to go on for at least 6 weeks."
Okay, that sounds sensible.
Yeah.
So that's a normal blood pressure. Okay, so that's very reassuring. Okay, I'm going to shine some lights in your eyes next. We'll turn the main lights off for this. So we're looking for the nerve head, if it's bulging or not. That looks absolutely normal. That's fine. Okay, a bit bright suddenly. Okay.
Yeah.
So look at me, and I want you to follow my finger with your eyes. Do you see double at any stage while you're doing this?
No.
I want you to raise your forehead up. Close your eyes tightly. Don't let me open them. That's fine. Show your teeth. Blow out your cheeks. So I'm just going to feel both sides of your face. I want you to tell me if it feels the same on both sides.
Yeah.
Does it feel the same? Okay. Just squeeze my fingers as tight as you can. The neurological examination is normal. The blood pressure is normal. We should just check some blood tests looking for other things that can predispose to stroke. So we're talking about raised sugar levels. We're talking about your cholesterol level. I imagine it's all going to be normal. It would still be good to just find out a bit more detail about the headaches. I'd like you to just clarify the visual symptoms a bit more and let me know after you've had the next one. I'd like you to keep a diary of when it happens, and I'd like to know a bit more about where in the head it is when you get it. All right? You can give me a ring to tell me about a bit more about the migraine once you've
Yeah, I will
had
do.
another one.
All right, yeah,
Okay.
thanks then.
Sure
Yeah,
then.
thank you.
I hit my knee like that, but look, Lynn, it's a big lump already. And I said I might have to come in on crutches tomorrow. The patient said to me, "You need a doctor." I went, "They're too busy for me."
Have a seat. So I'm presuming this is about your leg.
It is, yes.
Because it's a bit of a mystery, really, isn't it?
Yeah, have the scan people sent the information?
Yes, so they said there's no sign of a clot.
No.
Which is good. Possibly early cellulitis.
It's just got worse. By the end of Saturday, it was extremely painful. And now the pain goes from the toes all the way up to the top of my thigh.
Right, so where is the pain?
It starts off because I've got pins and needles in the toes anyhow, I can hurt.
And what's that from?
Don't know. When I drove home from work Sunday night,
Have a look at the other one.
I struggled to feel the clutch. It's old colour now as well.
It is. That's exactly what I'm thinking.
Yeah, weird.
How long's that been for?
The last 24 hours, I suppose. Looking for a pulse. Yeah.
I'm pretty sure I can feel a pulse.
Yeah.
Yeah?
That's good.
Yeah, it is good.
It's good news. It's alive.
I don't like the look of the colour.
No.
What I'm going to just do is see if I can find a nurse to just check. We can hear a pulse as well. Right. OK. OK.
I'm feeling quite hot again now.
Sorry?
I'm feeling quite hot
You're
again.
feeling hot. Come in.
Hello.
Thank you very much.
Hi.
Hi there.
So he's had pain and swelling in the leg, and we've ruled out a DVT, but it just looks a different colour.
Yes, it looks very pale. doesn't
Yeah.
it?
I think I can feel them, but I'd just like to hear it. Is that Saul just doing that, is it?
That's all right, sorry.
All right, huh?
That sounds right, doesn't it?
Yeah.
That's good news.
Fine, all right.
Thank you.
Just reassuring, isn't it?
Yes.
Fantastic, thank you. Right, OK. What I want to do is ring and speak to one of the vascular surgical doctors. I don't like the look of the colour of that. I don't like the sound of the pain either.
Do you smoke at all?
I do.
Any plans to stop?
I want to. I tried those chewing gums, they're disgusting.
All right.
And when I
give up smoking, I become a very quick lose temper. I'm like a Spanish bull, having head down, going.
Smoking. Do you smoke?
Yeah, I want to quit smoking, actually. I hate smoking. It's a waste of money.
It's a waste of money.
You are a smoker.
Sort of. I'm not really a proper smoker. I just smoke occasionally, sometimes, when I'm stressed.
You started smoking again? How many a day?
Not many, actually. 3.
Oh, you can stop that.
But it's that craving.
It is that craving.
It's like gambling.
So I'm going to quit the smoking.
We've got to grab you while you're keen.
Yeah.
Now's the moment.
Bit out of puff, aren't you?
I am, yeah.
Why are you here?
Yeah. About a fortnight ago, had a bug, bad, sweating. My chest has just got slowly worse and worse and worse. And last night I just more or less sat up all night just coughing.
Right.
Breathing's difficult as well. I'm trying to cough to get some up, nothing's coming up. But I can feel it rattling. Excuse.
OK, have you got any history of any breathing problems?
No, never.
OK, do you smoke at all?
No.
Have you ever smoked?
Yes. 12 years ago.
You gave up 12 years ago? How long did you smoke for?
Since I was about 15, 16.
Have you noticed yourself wheezing at all?
Yeah, I am wheezing.
And how many did you used to smoke a day at the most?
30 to 50.
30 to 50
when I
a
was
day?
smoking, yeah.
How do you find enough time in the day to smoke 50
I used to work
cigarettes?
on the markets, so you get there at
Just
6 o'clock in the
constant
morning.
train. Fair play for giving up then, well done.
Yeah.
What made you give up?
Grandson coughed watching Thomas the Tank Engine in front of me and had a fag in my hand, and I said, that's it, finished.
He coughed in front of you from you smoking?
Yeah, and I stopped.
Right, so we have this thing that we call pack years. So we work out your smoking history based on the number of pack years of smoking.
Yeah.
So the calculation is based on 20 cigarettes a day. So if you smoke for 10 years and you smoke 20 a day, that's 10 pack years.
Yeah.
OK, so let's average at 40. So you've got 68 pack years of smoking.
Not proud.
That is very significant
I know.
smoking history.
Yeah.
So anybody who's smoked for a long time has a significant risk of something called COPD, chronic obstructive pulmonary disease. So it's basically where you've got permanent damage to your lungs.
Yeah.
It makes you a lot more susceptible to chest infections and things like that. So pop your finger in there for me. Let's check you over now anyway. You look quite well, so hopefully it's not anything sort of like pneumonia or anything, but I'm going to have a listen to your chest. Right, have a stand up for me. Right, can we lift your T-shirt right up? Right, nice deep breath. So have a listen at the back. Try and touch your elbows together in front of you. OK, so you've got some crackles lower down on this right-hand side. I think you've definitely got a bit of a chest infection.
Yeah.
It would be wise if we give you some antibiotics.
Yeah.
And then once that's clear, you need to come back and have a review of your breathing again.
Yeah.
And if you're feeling worse at any point, rather than getting better, make sure you come and see us again.
OK, thank you very much.
That's really helpful. Thank you for your help. Yep, bye-bye. So he was really helpful, the vascular doctor. He says the colour can alter and be very pale and dusky just from the swelling, and the fact that we've got the pulse means the blood supply is OK. So that's
good.
That's good news.
Good news, yes.
Can I have a quick feel?
Yeah, of course, yeah.
If you can lie on the bed, that'd be good. Where does that hurt?
Hip.
Hip. OK.
I can lie down. Hang on.
You all right?
Back of the ankle now.
OK. Right. All right. You haven't fallen at all? No. OK.
I wish I had.
Yeah. Can we bend your leg at the knee? Yeah. And no. Where does that hurt?
Muscle that goes all the way up to my bottom.
All right. Up you go. With Raymond, we'd ruled out a clot in the leg, which was an important thing to do. But when I examined him on the bed, he could barely move his legs at all. He was obviously in significant pain. I was concerned there was either some hip problem going on or a problem with the lumbar spine. I think we need some more imaging today. So I think the best way of doing that is going to A&E. Right. I really hope they help us get to the bottom of this.
It would be good. It would be really good.
It would be good, wouldn't it? OK.
Thank you very much.
That's all right. OK.
OK, thank you. Thank you.
All the best. Bye-bye.
Thank you.
No, you made me laugh. I don't know why I'm laughing. Oh my God, I've just been sat in the waiting room laughing my head off. My sister put a photo of me on Facebook and eating a chicken carcass. And one of my friends said, "Is that a rat?"
Well,
And I said, "No, it's my sister." Oh dear. Anyway, right.
Well, good. I'm glad it's keeping you amused this morning.
Oh my God, it's so funny. I just have to show you. Hopefully, it'll make your day.
It is quite a photo.
Oh my God. Sorry.
It's fine. It's fine. Keeps me going.
This is great.
How are you getting on?
My knees are, on the whole, a pain.
Sure.
Still very painful. So at Christmas, I had pain in my right knee.
Yeah.
Which then got better.
Yeah.
And then I had a very bad acute pain in my left knee.
Yes.
And that is what is giving me most of the problems.
Right. And we referred you for the MATS referral.
Yes.
And they will look at both. Now, the right knee was the one that showed bad arthritis changes in the scan.
Yes.
And a little bit of wear and tear of the cartilage in the middle of the knee. Sometimes that can get locked in between the middle of the bones of the joint and cause your knee to lock and get stuck in one position. And that sometimes then needs them to trim it away and clean up the inside of the knee with a little operation. Whether it will need you to have a scan on the left-hand side as well will be down to what the MATS team say when they see you, I would suggest.
I would say generally it is getting better,
Sure.
but it's really affecting my life.
I think there's a difference between the two things that are happening, because one, we know that you've got really bad arthritis, and that's a different thing that's causing the pain from the thing that might be causing the locking, which is the cartilage problem. So let's boost the painkillers, wait for the MATS referral. I'll see you in about 4 to 6 weeks when we've got that, and I'll organise the scan.
Yeah, that's absolutely
But please
fine.
let me know if things get worse or you're worried or something else, all right?
OK, yeah, that's absolutely fine. Sorry about my entry. My goodness, that's right.
Don't worry. Keep me going all day.
Good.
See you later. Bye.
Thank you.
Nice to see you.
You love.
Take care.
See you again as and when.
Bye-bye now.
Ta-da.
You say thank you?
Have a nice holiday.
Yeah, thank you.
Enjoy the rest of your day.
Thank you. Bye-bye.
See ya. Bye.
Health Centre, can I help?
You're looking very down.
Yeah.
Tell me about that.
Everything's just getting to me at the moment.
This is a cyst, and Dr. Lee said she didn't want to cut it out because it's right on the jugular.
Thinking about trying the Weetabix diet.
The Weetabix diet?
At this point, I have to do something which is fraught with risk.
Oh, hello.
With your medical history, I don't think anyone will want to go near you unless they have to.
Health Centre, can I help you? Good morning.
Thomas Candrical.
That's me. Thank you for seeing me on such short notice, Doctor.
That's OK. Come on in, have a seat. I'm Dr. Graham. How can I help?
Right, if you look at my history, last year I had this case of a similar situation like this where my mouth lost skin, I couldn't eat very much, but compared with now, that was like a 3 or 4. This started off again on Tuesday or Wednesday.
Yes.
I have lost skin everywhere. I haven't eaten a solid meal for 4 days.
Yeah.
I went to the pharmacist. They recommended something called codeine with paracetamol.
Yes.
Which the pain has subsided, but even now, here I can still feel that constant throbbing. My head is hurting. But this hasn't happened for over a year now.
Yes.
I don't know what's happened.
OK, and do you have this kind of problem anywhere else on your body?
No.
No? You don't have
else.
any problems genital ulcers or anything like that?
What do you mean by genital ulcers?
Well, you've got mouth ulcers, that's what these are. They haven't got anything on your penis or anything like that, no. Just very rarely there can be a connection when it's quite severe, but it doesn't sound like that's the case.
No.
Can I have a look in your mouth?
Right.
Yeah?
The only thing, Doctor, my mouth probably smells a bit bad.
Don't worry about that.
If you want to probably put on a mask or something, at least it makes me feel a bit better.
No, I'll be fine with that.
Thank you.
Hello. Are you Phoebe?
Yeah.
Very good. Let's give you a chair, Phoebe. Are you going to sit there?
There you go. Ready?
And who's this, Phoebe?
Nancy.
Nancy?
I got some spots. Do you want to show the doctor where they are?
They're on my belly. Well, wait a minute. I think I need to ask Mummy a few questions first, and then I'll have a look at your spots in a moment. All right? How long has she had the spots for?
About 4.5 months. And they're only behind the legs here and a couple on the belly, and they look like little skin tags.
She's obviously reasonably well.
She's absolutely fine. I think she's got a little bit of eczema as well on the back of her legs.
Has she had eczema before?
Never, no. I think the hot weather's brought it out.
OK, we're going to have a look at your spots now, Phoebe. Will you show me your belly first? She's only got one.
She's got a couple on this
yes,
side.
I
You
see.
can see where she's and they've cleared.
No,
but it's
there's one. Look, that's a perfect one there.
Yeah.
The other thing is, Mummy wants me to look at your leg. Do you mind standing on the chair? If you just keep a hold on her. Yeah, a little bit. The name for that is molluscum.
Yeah, that's what I couldn't remember.
I'll print off the sheet for you. So it is a virus. And you don't want to do anything with them. Although they all go in the end, they can linger for quite a while.
Yeah, it just feels like
common, harmless, just try to ignore it.
But is that definitely eczema on the back of her legs there?
I think you'd call that eczema, but I mean, she may have got some spots and picked them and they've got a bit irritated. Let me give you some treatment.
Yeah.
Mild steroid, just for where it's bad. When you've cleared it up, leave it off and wait and watch what's happened. Okay. And if it then comes back, we would adopt a slightly different approach.
Yeah.
Here's some stuff on molluscum. I mean, she's got it very mild. Quite likely she'll get more spots. If she picks them, she'll tend to infect herself, but you can't stop her picking them. So.
Thank you.
Right, Phoebe, are you playing a game?
I need his gloves.
Phoebe, you may have that glove. Special present.
Wow, doctor's glove. Thank you very much.
Closer.
Can you sew it up?
No, that's Mummy's job.
Yeah.
Take the glove and take the book.
What do you say to the doctor, Phoebe? No! Can I?
It's very good.
Right, you're going to take your glove?
It's lovely to see you. Bye-bye. Bye-bye.
See his next patient. Thank you.
Goodness, it's quite a lot, aren't there? And then open up wide. Yeah, you've got a lot on the roof of your mouth and on the back of your mouth as well. All right, so most of the time, this is due to a viral infection that we can't really name. But just occasionally, it could be that this is a viral infection called herpes. Have you heard of that?
Isn't that an STD?
It can be an STD, yeah, but it doesn't have to be, OK? And I'm just wondering whether it would be helpful just to rule that out.
Just to understand you, though, because I haven't been actually sexually active for about 8 months because my girlfriend has long-distance relationship.
It's probably nothing to do with sex, this, OK? So there are two sorts of herpes.
Right.
There's genital herpes, and then there's herpes, which is just like really bad cold sores.
Right.
OK? And that is probably all it is, but it's really bad. So I think we need to investigate it a bit more. OK, it's a little bit of a rough swab, so it makes it a bit sore, I'm sorry.
No, as long as it helps you find out what's wrong, I'm cool with it.
If you could lower your lips down, I'm just going to do it along here, because you've got quite a few examples there. OK, that's great, that's done. OK, so that will take a few days to come back. If it's negative, then it hasn't really progressed us as to why this is happening. But some people do get terrible mouth ulcers. And there isn't very much that helps with mouth ulcers.
I've got 4 gels which I'm constantly using.
The problem is that as soon as you put them on, your mouth washes them away. If over the next week or two it's clearly just getting much worse and you're suffering a lot, then just come back in. OK?
Doctor, thank you very much.
That's all right. Good.
See you later, ma'am.
Yeah, bye now.
Michaela Farrell, please.
I'm so sorry I missed it this morning. I wrote down the complete wrong time. Oh, God. Thank you.
How are things?
Yeah, same. How's my x-ray? Same?
They're normal.
Yeah, I thought so. The tablets aren't doing anything. I really kept on with them and the side effects were fine. They went down.
The pregabalin?
Yes.
Yes, yeah.
And it's just still got this bloat and then this twisty kind of pain. I don't know what to do.
And how often does the pain come?
It's always there, just hanging around in this little patch. Like, I just don't know what to do now. Last week's been quite bad.
Right.
I haven't really slept.
What do you want to do you think?
I don't know. I do some kind of... I know there might not be... Sorry. Oh, God's sake. I'm just fed up and I just want this pain to go.
Yeah.
I can't do it anymore.
I mean, do you think the bloating is a big thing?
Yeah, massive. I'm so sick of it. I just look like I'm pregnant sometimes. Like, that's not...
Yeah.
I never had this issue before.
Yeah. OK.
Something weird is going on. I don't know. Ugh.
We've got GPs, we've got nurses, we've got other clinicians that can prescribe. You ring our number, 24 hours a day, 7 days a week, even when we're closed. We'll send you text reminders on your mobile phone of things that you book in advance. Modern. We are trying to go with it. We're trying to go there. I can't think of anything else. All right?
Thank you.
OK, welcome to the practice.
See you then.
Sean Walker. Oh, that kind of thing.
Hey, how's it going, Mum? Oh, hey. So I came here like a few weeks ago because I had like a problem and it felt like there was like a lump in my throat whenever I was trying to breathe in. And I'm not too sure if it's all connected, but like you see last night I basically couldn't get any sleep at all because I've got like this mad stabbing pain here. And then it sometimes can feel like a sensation up here. I got given omeprazole and another thing, and maybe cooled it off a bit. But because like I've run out of that now, it's kind of like starting to get this neck sensation thing again.
So the problems up here have been going on for a few weeks.
Yeah.
Better with the medication to some degree.
Yeah, so like...
And then that's finished.
Yeah, to be honest, it's like last night I had like an episode, I'd say, where it was really at its height and I could really feel it. I guess that's been able to suppress it to some extent, I guess.
Do you smoke?
It's maybe smoke twice at night, usually, do you know what I mean? Like, that's it, I don't really smoke during the day.
Alcohol?
I don't really drink that much, to be honest. I'm not really a big drinker at all.
Caffeine?
Coffee a lot at work. Like a lot of coffee at work, actually, I guess.
Let me examine you. So we're going to start at the top by looking in your throat. Say ah.
Ah. Ah.
It all looks normal in your throat. Now let's lie you on the couch and examine your tummy. If we lift your shit up.
Sometimes, like, when I was lying down last night, they'll just feel like a pain there, like, do you know what I mean? And you're moving about. And like, even if I move, like, sat up like this, I'd be, like, aware of, like, oh, this kind of...
OK, perfect. There's a good chance that the two symptoms, the odd feeling up here and the discomfort down here, are interlinked.
Right, yeah.
What most commonly interlinks those two things is stomach acid. So sometimes when you get excessive acid production, it's uncomfortable around where your stomach is.
Yeah.
But also you get acid coming up and irritating your throat, and that can happen while you're awake, but also at night when you're asleep. The medications that you had One of them was to suppress acid production. I think we should try a slightly longer course of the omeprazole.
Right,
so
right.
rather than 2 a day for a short period, 1 a day for a little longer. Now, while you're doing that, I think a couple of lifestyle changes. We know that caffeine and nicotine are quite irritating to your stomach. Cutting out caffeine and trying to cut out the cigarettes will probably make a difference to the symptoms and allow your stomach to
get healed. Yeah, totally, that's okay. Thank you very much anyway.
Best of
Thank you
luck.
very much for your time, man. Cheers. Thank you very much. Cheers, man.
It's important for us to think how many tests we're going to do.
Yeah, of course, yeah.
Because I think tests can be quite difficult for you. The more we go through them, they get more invasive as well. And there's more radiation and that sort of thing, which isn't good either.
Michaela is quite a new patient at the practice. She has sadly been suffering with pelvic and abdominal pain for approximately 3 years. She's been investigated quite significantly, but nothing has been found to help us work out the cause of her pain as yet.
You know, I think it's really reassuring that all your bloods were normal.
Yeah, that's good.
And your x-rays are normal, so it's good there's nothing sort of...
There's nothing really bad.
But it's also really frustrating, isn't it, that we can't say, that's it.
Yeah, I know. So, I don't know, what do you do now?
I think what we need to think about is helping you with the pain, really. If we got the pain better controlled...
Yeah, definitely.
I'm not saying get rid of it. Yeah. What our aim would be to manage it better.
Okay.
And I wonder if we ask the pain clinic for some help with that.
Yeah.
Because pain is a strange thing. The pain pathways are really tricky, and it's how we feel in ourselves affects the pain, and it's a bit of a vicious circle.
Yeah.
You know, if we can feel quite low and stressed due to pain, and then that can make the pain worse as well.
Yeah, definitely.
So with the pain clinic, they haven't got any different medicines than what we use, but they look at it in different ways.
Okay.
So what are your bowels like? Do you have any diarrhoea at all?
No, never have diarrhoea. If anything, it's not like constipated, but like it will usually be every day or every other day I'll go, and then sometimes it will feel like it's not quite out, like I don't know. It just feels heavy and just, I don't know.
Okay. Why don't we try some fibre gel?
Okay.
Have you tried that before? No. So it's a sachet, it comes, and it's just a fibre that you add to some squash or juice or water. I mean, I still do wonder if it could be an irritable bowel type thing.
Yeah.
Okay. And it just helps the stool go through a bit more easier.
Okay.
Okay. I think it's worth trying for a couple of months and see if that helps. Yeah. Okay.
Yeah.
There we go. Okay. So come and see me in a couple of months to see how you're getting on with this. All right, and I'll refer you for pain clinic in the meantime.
You.
All the best. Bye-bye.
How can I help?
It's about my leg. I want to see if anything can be done about the scar.
Ah.
Because it's quite hideous. And all down the back is just hanging there.
Yeah. How's the sort of numbness in that foot? Is it about the same?
Yes, I've got no improvement there. It's still numb.
And the operation was back...
December...
15.
15.
Yeah.
Yeah.
So the level of numbness, has it got any better or is it about the same?
It's still the same as when I had it done.
So I don't think that's going to change.
No.
Lorraine has a complex past medical history. At the age of 51, she was diagnosed with a lymphoma. During the course of having chemotherapy, she developed a clot in her right leg. She then went on to develop what's called compartment syndrome and an acute ischemia of the leg. What that means is that the clot expanded and she had to have an emergency procedure called a fasciotomy, whereby you literally slit things down in the leg to release the pressure. And it's an emergency situation, otherwise you're at risk of losing the leg. But you did have a bit of what we call foot drop after the surgery.
Yeah, I still got foot drop, but before I couldn't even lift it up.
No.
You know, I've now got control to
You seem to be walking more easily than
It's a bit
before.
easier to walk, but I can't walk very far at all.
Well, look, it's got better, hasn't it?
Yeah, I think
From
I've
what you were
given
going through, look how far you've come.
Oh, yeah, I mean, I couldn't even walk in the beginning. Now I can walk a little bit. Yeah.
When's your next haematology appointment?
Next Friday.
And are they happy with everything that's going on?
Yeah.
They're just monitoring you, aren't
Yeah, I go every 4 months now, so...
Okay.
I hope just every 4 months, that's all I want.
What are you hoping that they do?
I'm just
improve the appearance.
Yeah, because all this flesh here is just so loose.
Yeah.
I was wondering if maybe something could be done for it to be brought together, because I don't really want skin grafts after what I went through with the last one.
Do you moisturise the skin?
I do. I use bio oil on it, which they say for scars,
Yeah, and just general moisturising.
Yeah, I use moisturising creams and I use bio oil on the actual scars.
OK. It's a difficult one, Lorraine, because firstly, this becomes a cosmetic issue.
That's what I was wondering.
Which, secondly, with your medical history and with the tablets that you're on,
yeah,
I don't think anyone will want to go near you unless they have to. I'm being completely honest.
Yeah.
And I'm not sure there's much that can be done there. If you open up other scars, you create scars on top of scars, and it doesn't really help it.
Yeah. I mean, would anybody be prepared to see me to discuss it, do you think? Because it is, I mean, it is ugly, isn't it?
Firstly, on the NHS side of things, we'd have to apply for funding for you to be seen, and I don't think we will get that.
Yeah.
Because I'm not sure that there's much that we can do. On the whole, cosmetic surgery is not funded by the NHS. There are certain exceptional circumstances whereby a committee looks at the evidence provided to make a decision on an individual basis. So, for example, if somebody is suffering from severe emotional and functional impairment as a result of their disfigurement, this may be looked at in a different way. I can discuss it with a colleague of mine.
Yeah.
If you're happy for me to take a picture.
Yeah.
Is that OK?
Yeah, that's fine.
It's nice to see you smiling as well.
Yeah.
You're happier in yourself, I think.
Yeah, oh gosh, I've come a long way.
You have come a
massively from what I was, because...
So leave that with me, so to speak. But I can't promise anything.
No, OK, that's fine.
Are we supporting you enough? Do you need any further counselling with what's happened, or you do feel you're happy?
No, I'm OK. I've had loads of counselling. I'm not on antidepressants anymore. I mean, I still get down days. Of course you do, but I think anybody who hadn't been through what I've been through gets down days, don't they? But
I think you're
on
an
the whole,
inspiration, actually, of how well you've done.
On the whole, I'm not doing too bad. I don't work, obviously, now I've been retired. I just try and keep myself busy.
OK, we'll leave it at that for today, if that's OK.
OK, yeah, that's fine.
Nice to see you.
Yeah, and you. Thanks very much. Thank
All right.
you.
Bye-bye for now.
Bye.
Robert Bees, please. Hello there. Hi there.
Hello, all right.
Robert, you're looking uncomfortable.
Yeah, it's my legs still playing up and my back. I went to see Sightmead.
Yeah, these are the nerve conduction studies, aren't
Yeah,
they?
they'd done all that, and they said they was going to write to me, and I haven't heard nothing.
No, OK, I have to say I haven't heard anything either. I'll write to the neurologist and say, look, it looks, you know, this chap's had all his tests done.
Yeah.
They did the electrical test on your arm and your leg,
They've
did
done
they?
it on my arm and my leg, yeah. Oh, just down in the dumps still, really.
Well, you are, aren't you?
Yeah.
Let's talk about that, because that might be more important even than the pains, isn't it? So I saw, since I last saw you, I gather you were evicted from your parents' council house, is that right?
Yeah.
Where are you living now?
I just stay with my sisters.
Yeah.
4 days a week.
Okay.
And then I just stay with my daughters just on the weekend.
So is that the long-term plan, or are you trying to get something else?
I'm trying to get somewhere. I went for a property and they said I was unsuitable.
You're not in work now?
No.
No. How's it working out, staying with your relatives?
Not very good, really. But I've got nowhere else, so just got to do that.
Yeah. And you're looking very down, and you said you feel quite down.
Yeah.
Tell me about that.
Well, it's just the loss of mum still going to me.
And my sister and my dad. Just everything's just getting to me at the moment.
How do you fancy draining a cyst behind an ear this afternoon? Yeah. I thought about doing it, but then I thought, oh, it sounds like something Tom might like to do.
What kind of cyst?
A very squidgy one that looks like it might be about to pop. It's probably about that big, very, very squishy.
Okay. It would happily stick a needle in it and just see if it'll aspirate.
I think it will probably just aspirate. I think the second you put a needle in it, it's probably just going to go.
Yeah, well, that's fine. Book him in, I'll do that.
Debbie Kroll. Hello there. Come on in, have a seat. I'm Dr. Graham.
Hello. So last time I think I had a water infection.
Did I?
Yeah. I think this is a cyst, and I think it's getting infected.
Okay.
It has been once before, and Dr. Lee said she didn't want to cut it out because it's right on the jugular. But over the last few days, it's hurting.
Yeah.
It didn't hurt last time, but it is hurting.
And has it changed as well as being painful? Is it bigger or?
It's bigger and harder, and it feels a bit warm.
Okay.
But I just know it's just... No, I feel a bit sicky, but I don't know if that's just... I don't know, I've got a job interview tomorrow, so I don't know if I feel sick because of that or if it's because of that.
Yeah, OK.
But last time, not at all did it hurt, and it just oozed horrible pussy stuff.
And nothing's come out this time?
No.
OK.
No, so I don't...
Should we just take your temperature first? That's fine, 36.1, so that's normal. Just take your pulse. What's your job interview?
I work in a school anyway as a teaching assistant, and it's in the same school but for a different teaching assistant role.
OK.
So yeah, I'm just a bit nervous. It's ridiculous.
Do you want it?
Yeah. I just think it's horrible when you work there and you have to have an interview with people you know. Yeah.
Difficult, isn't it?
It is horrible.
OK, let's have a look. I'll just put some gloves on.
OK.
Yeah, it has got a little head on it, hasn't it?
Oh, I don't know, has it? OK.
Little white bit.
Yeah, so maybe it is then, because it doesn't usually have a head on it.
Yeah, that's how big it is. And it's a bit red up there as well.
Yeah. And that is sore when you touch it.
So I don't think you should try and squeeze it.
No, I won't.
Okay?
No, I won't.
And hopefully it'll get better with some antibiotics, which I think is what we should do. Yeah?
Yeah.
So we normally give 5 days of flucloxacillin, OK?
Yeah.
4 times a day. And if it's obviously getting worse, then you come back. Or if you feel ill, like you're being sick or something. It's basically a sebaceous cyst, which is part of the hair follicle that's got a bit blocked and caused a lump, and then that is prone to getting infected. So it's really common and not anything surprising, to be honest. As this is the second time it's happened, you could discuss with Dr. Lee whether she'd be willing to remove it. But I can see why she's a bit reluctant.
She's a bit anxious about that, I think, and that's fine. I don't want to,
Well, you don't want
it's
things
a bit risky. Yeah.
Exactly. Is that all right?
Yes, of course. That's absolutely.
And good luck tomorrow.
Thank you very much.
That's all right.
Fingers crossed.
Yes. Bye bye now.
Thank you. Bye bye.
Had you thought about if there's anything I could do to help you?
Well, you give me this letter to ring up about when I was down in the dumps before.
For the get some counselling.
Yeah. They rang me back and said I can go to a meeting.
Yeah.
Which I went there and they was talking to me and everything like that. And they give me the number. They said any time you just ring. So.
I think it would be worth you ringing maybe and asking for some one-to-one counselling.
Pain her now with that lump as well.
Yeah, OK. Let's just stick with your mood for a second, because I don't want to lose this opportunity to talk about that, really.
Yeah.
So these were the people you rang, wasn't it? Bristol Wellbeing Therapists. Yeah. I would encourage you to give them another ring, actually. Right. That's the number.
Yeah.
And say that you went to a group session before, that you're very down in the dumps, and that maybe some one-to-one counselling would be helpful, and they would they'll take that on for you.
Yeah.
All right, so I'd
Yeah.
encourage you to do that. Are you still taking the antidepressant that you were prescribed by my colleague?
Yeah, yeah.
Can I suggest if you've not had side effects, but obviously you are still quite depressed, maybe we should put that dose up to 100 milligrams
okay.
and see. Okay?
Yeah.
You're probably running out of it fairly soon, actually, aren't you?
Yeah.
So I'm going to give you a higher dose of the antidepressants. So I'll put a prescription for some of that through to the pharmacy next door. You're going to contact those people. I'm going to write to your neurologist. There we go. All right.
Yeah.
I think that's covered enough for today. But I'll come and see me again in a month.
Okay, make an appointment for a month's time.
Bye-bye.
Well, thank you.
Francis Pollard, please.
Hello.
Oh, hello. Have a seat. You Dad?
Yes, I am. Who are you, by the way?
Francis, then. I'm Lizzie.
So, I'm here for him, obviously. So he had a bout of vomiting and being generally unwell a couple of weeks ago. And since then, he's had a cough, but only at night. He's had a recurring cough for about a week and a half or so. He was pretty down to sort of recovering a little bit, but then it was a bit during the day, but now it's confined entirely to the night. So
do you think he's had a fever at all then in the last couple of weeks?
No, not since he stopped vomiting.
So has he had a snotty nose?
Yeah.
Can we take your temperature? Can we do this in your ear? Just beep, beep, beep. Ready?
Yeah.
Beep. Perfect.
Good boy.
And when he's coughing, what does his cough sound like?
It sounds like he's got loads of phlegm in his. To me, he sounds like it's
wet. Sounds wet.
Yeah.
Okay. Has he been coughing anything up at all? Have you ever found any nasty green phlegm or anything? You're very chilled, aren't you?
He's tired.
Can we take his shirt off and undo his baby grow?
Yeah. Can I just use your bed over here for a second?
Yeah,
Because
that's fine,
I struggle to do this otherwise. It's a good boy. Who's my good little man? Where are we now? Where are we now? What are we looking at? I know. It's a terrible world, Francis, where I continually dress and undress you.
So is he waking himself up when he's coughing at night?
Yeah. Skin the bunny, Francis. Thank you.
It's a horrible thing to say.
That's what his mother says to him, and it works. He now puts his arms up in the air.
Oh,
I know, it's what her mother used to say to her, apparently.
Oh, God.
I think it sounds like a terrible thing to say to a child.
I think it sounds like a terrible thing to say to a child.
But now it's the only way I can get him to put his arms up to take his grow off. Come here.
Right, should we have a listen? Pop this on here. Just turn him around.
Did you row?
His chest sounds completely clear. Let's have a little tap. Lovely.
You're fine, aren't you?
You're absolutely zonked, aren't you? I think he's just got a viral cough. Keep him well hydrated.
You mind if I start reassembling?
Yeah, that's fine.
You can take me a few seconds.
Reassemble your child. Is he in a cot?
Yes.
So prop the cot up underneath the feet, because if he's elevated a little bit, it's likely to help reduce his cough a bit.
OK.
If at any point you think that he's actually struggling with his breathing,
Yep.
if you start seeing the muscles really working hard in between his chest, if you can see his ribs appearing when he's breathing, come to us straight away, or if it's out of hours, give 111 a call.
OK.
You're happy enough, aren't you? Ticklish. You ticklish. You ticklish.
Why is it only at night?
It's just to do with the fact that you're lying down. OK, so any worries at all, give us a shout again.
Shall do. Thank you very much, Doctor.
All right, take care.
Cheers.
Bye. Bye.
I have got, I think it's a mole, but it's been a bit itchy.
We call it a seborrheic keratosis, and it's
Right.
just a little warty stuck-on thing.
Yeah. It's almost like there's a crust over the top of it, isn't there?
That's been getting a little bit darker and bigger. Not that it's that big.
It's kind of a little bit of a dry, scaly one. And it's just quite soft and loose.
Yeah, so that's more reassuring, actually.
Well, the good thing about this one is that it's a little fleshy one that sticks up and you can move it around.
That's what the doctor said last time.
Kay Frankson, please.
Hello.
Good morning. I'll have a seat.
Thank you.
I'm Dr. Jewell.
Hello, Dr. Jules. I hope I'm not wasting your time, but it's just people keep telling me to come and see you because I've got this mysterious mole that's suddenly appeared at the back of my knee.
So let's ask the standard question. Is it bleeding?
No.
Itching?
No.
But it's new?
It's new and it's...
But you don't, because if you have many moles...
No, not really.
The average number is 40.
Is it?
Yeah, so most of us have got a collection.
Oh.
So let's have a look at it.
It's this one, so it's at the back of my left leg.
Ah, at this point I have to do something which is fraught with risk.
Oh, hello.
Is it this thing here?
Yes.
Okay,
Well, there's a cysty thing as well.
Have you seen? Have you looked at them?
I can't see them
So
really.
which is the one that everyone's worried about?
The one that's actually coloured and looks like a mole.
Well, they've got 3, 4 of those.
Oh, well, there you are. You see, I can't even see them, so I didn't know.
These are obviously, quite obviously, warts. Because what they're doing...
That's horrible.
Look, what they're doing is when you bend your knee, you're spreading them. I think the sensible thing to do is to take a photograph of them.
I've done that. I did it the other night to have a look because I knew I was coming to see you.
You know, check it again in a few months' time.
It was quite hard to take, actually.
Oh, I'm not suggesting you. Surely you can get somebody else to take it, can't you?
Could do. Hello, would you like to take a picture of my mole?
I don't really have any other suggestions because they look completely normal. Okay. All right.
All right. So that's it then.
Yeah. And do come back if you're worried. You know, whatever you do, don't let concerns about wasting anybody's time deter you. That really, you know, this is a 5-minute business. It's taking a bit longer, but
all right.
It's not a big deal at all.
Okay. Well, thank you very much for reassuring me.
Good.
And have a nice day, as they say.
Bye-bye.
Bye-bye.
Catherine Bowers. Come and have a seat. I'm Dr. Barnard. I don't think we've met before, have we?
I've seen you before. Basically what it is, I'm a diabetic.
Yes.
And I got I got a blister to my little toe and the next toe.
Yes.
Underneath, and I think it's got infected. Because it's really sore, I can't walk properly, and there's like a red line just starting to go up there. It's not the first infection I've had in my feet before. It's...
Oh, goodness, that looks
really sore.
quite nasty, doesn't it?
Yeah, it's very sore.
How long's it been going on for?
It's only started getting red and swollen past 2 days, and that line just showed up this morning, but it's been sore for a week.
Right.
But I didn't think it was infected because I kept it clean and stuff like that.
Yeah.
But it's just, I think my toes swollen as well, and that line's coming up, which is worrying me a bit.
And are you under podiatry or anything like that? Have you been in the past?
No, because I don't like people touching my feet. I hate it.
Okay.
I can't bear people touching my feet.
Can I have a look?
Yeah. I mean, it must have been the one on this toe I left a bit too long and it got very nasty.
Pull that toe back for me.
This one?
Yeah. It's really painful, isn't it? Put your foot back down again. Fine. Okay. That looks really sore.
It is sore.
Because you've got the diabetes. We have to be really careful because you know if we leave foot infections untreated or not properly treated in diabetics, it can be quite serious.
Lee Huggins. Hello.
Hello, you all right?
Yeah. Come on in.
Thank you.
Have a seat. How can I help?
It's my right kneecap.
Okay.
I'm all right doing long walks, but when I stop, it seizes up.
Right.
And I have to let it rest for a while before I can... And if I start walking it straight away, it hurts.
Yeah.
I can kneel down on this knee, but I can't put this knee down properly.
No. Can we have a look at your knees? Do you want to just pull up? And could you do that with the other one as well, just so I can compare them? That's it. you can see that it's a bit swollen up there, can't you? And if I just have a press round that side, that's okay?
Yeah, it's fine.
Round here? Does it actually hurt if I press there?
No.
Okay. And if you fully straighten it, does that hurt? No? Bend it? Straighten it? Well, that's pretty good, isn't it? And if you just move your knee just so that your ankle's there, yeah. And I'll just give it a bit of a test. It's quite stable, isn't it? Yeah, good. OK, you put your trousers back down then. Your knee is taking quite a lot of weight at the moment because it's the main joint that carries you around. Have you had thoughts about losing quite a bit of weight at all? Any thoughts about I mean, I think it would really help with what you're here for today.
Think about trying the Weetabix diet.
The Weetabix diet? So what's that one?
Just Weetabix 3 times a day and that's it. And
Really?
then you play with your fruit.
Right. Sounds a bit crazy to me. What do you think about it, really, the Weetabix diet?
I think it's all right.
Yeah? I mean, do you know how people successfully lose weight?
Well, you've got to mix the exercise and the healthy eating sides.
Most of losing weight is simply eating less. So I actually say that most people who successfully lose weight just say, I'm going to change the way I'm going to eat for the rest of my life. Because a lot of people do these diets, like a Weetabix diet, and unfortunately, when they go back to what they normally do, they just put the weight back on. So sometimes I suggest to people they just reduce the quantity, because quite often, quite a lot of us are eating more than we need to.
I have breakfast. Sometimes I have lunch.
Yeah.
But I do have a dinner.
Yeah. People who eat breakfast are in general thinner than people who don't. And people who eat a small regular meal 3 times a day are lighter than people who don't do that. Your body is sort of needs regular eating. We all eat our main meal in the evening in this country. And the problem with that is that we're having a lot of calories and then we go to bed. And actually, when we need the calories is the morning and the lunch, and much less in the evenings. If there's any way that you can change that around and have your main meal at lunchtime, that's supposed to be healthier.
OK.
If you wanted some more help about losing weight, then you could book maybe to see one of the practice nurses or something along those lines.
OK.
Is that all right?
Yeah.
OK.
Thank you for that.
That's all right. Nice to see you.
Nice to see you.
Bye now.
Bye-bye.
Can I touch your feet to see what the pulses are like?
Yeah, both feet.
If it's too much.
No, it's okay.
Is that very sore?
Yeah, that is, yeah.
OK. Patients with diabetes are at increased risk of having problems with their feet. This is because the diabetes may reduce the blood supply to the feet and may affect the sensation. This means that patients may not notice when they've got a sore foot or an injured foot. If it is not treated promptly, the patient is at increased risk of having a serious infection and ultimately, in the worst cases, at risk of amputation. What I'm going to do is I'm going to give you some antibiotics. We're going to get you booked in with the nurse to get it dressed and things, and then I'm going to have a look at referring you to the diabetic foot clinic.
Okay.
If I do that, will you go?
I promise you I'll go, because I don't like people touching my feet, but I don't want to lose my feet either.
More than anything, we need them just to look at it, keep an eye on it.
Thank you so much.
So look out for the appointment, but if there's going to be anything different, and they're just going to give you an appointment straight away, I'll ring you.
Thank you so much. Thank you.
OK, bye.
Bye.
Mr. Thomas, please.
That's me.
Hello. Sorry, you've waited a little bit there.
That's all right.
There we go.
Thank you.
Right, do have a seat there. Hello.
Cheers, hiya.
Hi, I'm Dr. Bolam. All right. What can I do for you today?
Well, it's been coming on about 3 weeks now, this lump. It started off, well, didn't even notice it really, and then gradually, it's not got any bigger. It kind of, if anything, spread slightly.
Yeah.
But it's just fluid, I guess.
Yeah.
But I thought I'd leave it a few weeks and it'd probably go away.
I know exactly what that is.
Right, yeah.
Okay, it's a bursitis. Okay.
Yes.
So we all have fluid-filled sacs around our joints called bursae.
Right.
Okay, which can get swollen all of a sudden, OK? Usually caused by repetitive trauma. So that one there, people get them on their knees often. Anybody can get it.
I got you.
So that's an olecranon, that one, over the outside of the elbow. All right? Is it painful?
No.
No, not painful.
Maybe
OK.
if you put pressure on it, like lean on it or something, it might be annoying.
They can get infected, but it doesn't look infected, so we don't need antibiotics.
Oh,
all right?
right, okay.
Usually, the first line is to take an anti-inflammatory.
Yeah.
Right. Get something to compress it. So go and buy yourself an elbow support from the chemist. All right.
Okay.
Put ice on it, and it usually just goes away. All right.
Brilliant.
And only if it gets red and hot and horrible do we need antibiotics, and we're not at that stage at the moment, certainly. All right. Yes. Have a little read of this.
Yeah. Sure. Thanks.
Tells you how to treat it.
Yeah. I lost the wife coming up 5 years August, and seeing her in conditions that she was in, it does tend to make you...
Yeah.
I mean, I don't come to the doctors very often at all, but it suddenly... you think, well, one thing, keep on top of it.
Yes,
You know.
I can absolutely assure you that's nothing.
Ah, lovely.
100%,
All right.
actually.
Thank you very much. For
All right,
putting my mind at
OK.
ease.
All right, OK.
Thank you, Doctor.
OK, have a read of that.
Yeah.
Do what it says.
Thank you
All
very,
right.
very much.
Is that OK?
Yes, thank you,
All right,
Doctor.
OK.
Cheers now.
All right, have a nice day. Bye-bye.
Bye. It's all right, I got a bit of OCD as well, don't worry. It's not worth talking about, I just handle it.
All right. Okay.
Bye, thank you.
All right, bye-bye.
Bye-bye. Bye. Thank you. Have a nice day.
And you. Bye.
Thank you.
Bye-bye.
Bye. Do you feel better now?
Yeah, I feel better. You going to say bye now?
Yeah.
Reluctantly. See ya.
Good morning, Wolford Health Centre. How can I help?
It could kill you. Yeah. Or paralyse you. You're stuck in a bed at a young age.
There's a viral bug that's causing a bit of sickness, a bit of vomiting.
But yesterday, someone told me if you're puking up, you could have stomach cancer.
I could hardly hear anything yesterday.
But you're not having difficulty hearing me.
No, no.
And if I lower my voice, you can still hear me.
So your legs have taken a fair battering, haven't they?
I can't wear a bikini anymore.
I need to bring your arms slowly forwards.
Oh, ow, that's new.
Good morning.
Good morning.
Hi, all right. Filled out all the forms and stuff.
We're all good to go. Hopefully you won't be sick, but welcome to the practice.
Thanks for your help. Cheers.
All right,
Nice
thank
day.
you. Bye-bye.
Bye-bye.
OK, hello, everybody. All right, you have a seat. How are you doing?
My chest is quite bad.
Right, OK.
I had a scan on Friday.
Yes.
And the baby's fine.
Yes. That's
No
good,
worries
isn't
at the
it?
moment, yeah.
Yeah. So how long's the chest been a problem for?
Over the weekend.
OK.
I don't know why. I don't know if it's changing weather or
changing hormones, I don't know.
Yeah, and tell me a bit about it.
Just struggling to breathe.
Okay, so sort of tight.
Yeah.
Yeah.
Can we come off of there, please?
And remind me, you're asthmatic, yeah?
Yeah.
And you take 2 different inhalers, yeah?
Yeah.
You haven't had that many of them actually, have you?
No, I had spare ones at home, but
yeah,
I haven't. I'm just on my last one.
Okay. What do you think's going on? Tommy, I'm going to give you something to do. All right. Can you do a drawing for me? Okay.
Sorry.
It's all right. So let's just see what your temperature's like. That's normal. Is the pen not very good? What you have to do is you have to hold the pen so it's like that. Okay? Do you want one too? Yes? Okie dokie. You're good at drawing. Okay, there you go. Okay, so let's have a listen at the back first, just to breathe. Oh, that's fantastic. Oh, you've written your name. Wow. Can you do that again? You are quite wheezy, actually. Let's see what you get on this. $300. So that's a bit down.
Hopefully I can be fairly brief.
Oh, well.
In 2012, I came to the surgery to talk about jock itch because I was getting itchy.
Right.
So he gave me some Dactocort or
Yeah.
something. And it's never really gone away, 5 years later. And then, obviously, a lot of it's out of sight. And I took a photograph of my buttock about 3 days ago. And I thought, well, actually, I need to try and do something about it. I presume that's all part of the same...
Probably.
Same thing.
Yeah. Can I have a little look today? Is that
Yeah.
right? Do you want to go behind the curtain or are you all right?
I'm not bothered.
And is it itchy?
You know, the general itchiness, you know, it comes and goes a bit.
Yeah.
There's up the crack there.
Yeah. Is there anything around the front?
Well, it's often a bit itchy underneath.
Yeah. There's not much to see at the front there.
But, it comes and goes, but it's never really gone away.
Sure. So it does look very fungal.
Yeah.
And the Dactocort cream has got some steroid in, which reduces the itch as well. So it's a really good starting point for what you've got. Now, if it's not working, then we can try a different antifungal medicine, and usually that will we'll find something that we can use that works.
Yeah.
And the other thing is to try a slightly stronger steroid, just because the area is all a little bit inflamed.
Right.
And I think that that will help settle down the itching side of it.
Yeah.
Sometimes you need to use a tablet of antifungal
Yeah.
to make sure that you're getting on top of it, because sometimes it's
Right.
tricky to treat. And if it's been there for a long time and cream isn't making it better,
Yeah.
then that may be the next stage.
Yep. OK, that sounds all right.
Nice to see you.
OK, thanks.
Great, I hope that
Cheers.
works.
Yeah, I'll give it a try.
Bye-bye then.
Thank you.
That is a bit down, your oxygen, compared to what I'd expect it to be. Right, I think what we should do is treat this as an asthma attack. I think we should give you 3 things, yeah? I'm going to give you a spacer, you know, like one of those...
Tommy, get down, please, because you'll hurt yourself, good boy.
If I draw a picture, will you colour it in? What's that?
Dinosaur.
A dinosaur? I know I'm rubbish at art, but it's not that bad.
That's
it's
a cat.
OK, you colour it in with that biro, OK?
Mommy, that's a dinosaur.
Oh, that's brilliant. OK, so I'm going to give you a week of steroids, a week of antibiotics. It's OK with the pregnancy. In the meantime, you could also use a bit more of the blue inhaler at a time, which I'll give you. And unfortunately, in pregnancy, fantastic colouring in. Your asthma can get worse. Thank you very much. Now, can you put the lid back on my pen? And are you going to give me your picture? Thank you. And we'll see you again if that doesn't sort it out.
OK, thank you so much.
That's all right. Bye, boys.
Thank you.
Bye now.
Oh, dear. You still got your cough?
Oh, it's terrible. They said we'll allow 6 weeks, so it's only 3.5 weeks so far. So.
Not that you're counting.
No.
Yes, what can I do for you?
My anxiety's through the roof at the moment. I cry for days.
I can't go to the toilet. That's another thing. And when I do, it hurts.
Doing a poo or
yeah,
a wee?
And I keep getting pains under here and
Right.
around my back. And you know me, I convince myself it's my heart. Oh, I know, I know. I can't help it. I hate being like this. I really do.
I know.
Sorry.
What are the big stresses you've got at the moment? Apart from your physical thing, what's going on?
Apart from Edward just leaving Bristol, nothing really.
And then her other door's leaving as well.
How far are they
They're
going?
just going, one's going to London, one's gone to Dawlish. I don't know, I phoned 111 the other night and this guy chatted to me for like half an hour. He was absolutely fantastic. He managed to calm me down and the pains went. I know I'm probably a waste of time and space and energy, but I just feel... I just want to cry. I don't want to cry. But anxiety is something you can't help. I just can't switch it off and go, oh, it's nothing, and carry on. When I'm sat in a chair crying, I generally feel, you know, this is the end. If I can't get to the toilet, I push so hard that I do get pains under there and around there. So I know it probably is constipation as well. I just feel an idiot now, sat here, feeling stupid.
But you've got a problem. But I think your problem's anxiety, really, and fibromyalgia. When you say you're constipated, how many days has that been for?
I couldn't go yesterday. I couldn't go the day before.
Come over here and let me feel your tummy and just have a look at you.
I'm sorry.
OK, so lie yourself back. Do you ever pass any blood or anything?
No.
A little sore there. And over there?
Yeah, that's where I usually get my IBS pain.
OK.
If you find a heartbeat that's not mine, we're in trouble.
So what you've got is very exaggerated bowel sound, so it's going blah, 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 blah in there, you know, it's noisy.
Dr. Roberts said when he diagnosed me with irritable bowel.
Is that what he said? Well, it's the same thing. So I think at the moment...
It's not irritable, it's downright nasty.
Yeah, nasty bowel, but it's not dangerous bowel, and I'm sure it's the same thing. And when you get stressed...
It plays up worse.
It plays up.
It's awful.
Do you remember over the years what treatments you've had for anxiety? Did you have cognitive behavioural therapy?
I did. I think that was left once.
If you ever want to try CBT again, we can get you sent back, because in the long run, that's probably going to be the most effective. Go home and just think about this being anxiety and
Relax.
And relax. And your children haven't left the planet. They're just doing well and gone
You've got
to
your
London.
grandchildren.
Yeah, yeah. Well, you will get used to it. It just takes a while.
Thank
Okay.
you.
All right, OK, bye.
Thank you. Bye-bye.
Ronald Trump. So you haven't been up to much in America recently, have you?
I phoned the 111 people and they scared the hell out of me by saying, oh, you've got an hour to get to hospital. I was like, ugh.
I think by that what they probably meant was your appointment's in an hour, so you've got an hour to go.
And it looks a little bit snotty.
Say, no, I don't.
I have a migraine.
Migraine. I don't know what you call them.
I don't even know how it's spelled, so I'll just leave it there.
Did you see any boats on the canal?
On the canal?
Yeah.
What
canal?
canal? Oh,
Hi, what are we talking about?
Right. Basically what it is, I'm finding my ankles in particular really difficult to deal with, especially my right leg. I don't know what this stuff is on my skin, but it seems to be pain, swelling.
How long has it been swollen like that for, then?
The last few months.
Is it in the ankle or is it in the leg?
It's right in the ankle.
Yeah, let's have a look at the other one.
Now, the other one is...
So what happened to this leg, then?
Oh, this... Oh, God. I had polio when I was a baby. I was one of the last ones to actually get it and caused paralysis from my knee downwards into my foot. And this is necrotizing fasciitis. Started off with a stinging in my knee.
Yeah.
Then after about 10 minutes, I started shaking and perspiring.
Yeah.
I read up on it, and there's a certain type of house spider which carries a bug.
So it's left you incredibly disfigured, hasn't it? With all that infection, and then presumably they did an operation on it?
Yeah, they had to take.
You were lucky not to lose the leg?
Yeah, layers of skin from my bum.
Yeah.
It's such a nice bum before as well. Whatever.
It's this one that's the problem today.
My foot won't be very clean because
that's all right. Don't worry.
I can't get down.
That's all right. Don't worry. Let's. This brown skin is called varicose eczema. And that's because of the varicose veins, the fluid leaks out, and that brings with it some iron. So some of the veins then leak, and the iron it gets deposited in the skin, and it can cause usually itching and brown staining, but it doesn't usually cause a lot of pain. Can you make the ankle go round at all?
I've got no movement in my toes whatsoever.
OK. So your legs have taken a fair battering, haven't they?
I can't wear a bikini anymore. It's stupid. It just get laughed at.
And you've had the heart done as well, haven't you? And I guess I'm just wanting to listen into that and listening to check your chest as well.
The brain's all right, by the way.
Good.
So far, anyway.
So I think that there are lots of things that are going on here.
Yeah.
One of them is that I think you've got this varicose eczema, and I can give you some steroid cream that will help in case any of this is linked to that rash that you've got.
Yeah.
It wouldn't particularly explain the leg swelling.
No.
And it's also that there may be some arthritis or some damage in the ankle on that side as well. So I'm going to get an X-ray of the ankle and just see what that's doing.
Right, OK.
In terms of the heart, that could be linked as well, because you've had the valve replaced. Sometimes if the heart isn't pumping very well, that might make some fluid collect in the ankles as well. So I'm going to get a blood test to check the heart and the kidneys and the liver, and I'm also going to do a chest X-ray to make sure there's no fluid collecting there. Now, when I listen, there isn't, so that's good news.
That's brilliant, OK.
How's that for a plan?
That's fine. I've given up the cartwheeling. It's just ridiculous, you know. Anyway.
Listen, well, I'm glad that you're keeping in good spirits.
You've got to have a sense of humour, otherwise you just go absolutely...
Well, I think that's definitely true. That's definitely true.
OK, thank you very much. By the way, what's brown that runs around the garden? A fence. All right, see you later. Bye-bye.
I'm Dr. Graham. So how can I help today?
I have had a sore throat since Wednesday, and as of yesterday and today, it is raging.
And have you noticed anything else, like a temperature?
Today I probably feel like I've got a bit of a headache and a little bit hot, but then I've had a boozy weekend, so I don't know if it is that.
OK.
So I can't really differentiate between the two at this minute.
And are you coughing much?
Not coughing much, no, but if I have had the odd cough, then it really hurts sort of right in there. I can
bring anything up when you cough?
No, I'm not bringing anything up.
OK. And you remind me, do you smoke?
No.
OK. So let's check you over. Take your temperature first. Open up wide. Put your tongue back in, actually. I'm going to put it down a bit just to look at the throat. OK, that all looks fine. You actually don't have any tonsils to see, which is normal for your age.
Right.
OK, so they disappear as you get older because you don't really need them. Just relax your chin down. And it doesn't look too red, and you've definitely not got any pus or anything. Does that feel sore
really,
under
really
here?
Sore there, yeah.
OK, so that is sore there, but no glands that I can feel. But that is where your glands are, and they probably are sore there because that's... Do you know what your glands are for?
No, I haven't really thought about it, to be fair. But...
so they're where you make white cells. So when you've got a sore throat or any infection, you make more white cells, and that makes the gland get bigger. And often it actually hurts quite a lot, in some ways more than the problem that it's trying to fight. So I think that's the main problem. So I think the most likely thing is that this is a viral sore throat, OK? And that unfortunately it will last probably another at least few more days, maybe even another week.
Right.
You've had it since Wednesday, so it's about day 5 now. And they say that it takes sort of 7 to 14 to clear. And at the moment, I think that you will, you're normally quite well, and you will probably clear this yourself. It's a kind of annoying problem where, if I get it, it's not much more I can do apart from take painkillers and wait for it to go.
Okay.
And at the moment, there's no evidence that you've got the kind of infection that will get better quicker with antibiotics.
Right, OK.
Does that make sense?
Yeah, no, that's fine. I just wanted to make sure that there wasn't anything, because it's just been getting worse, so that's fine.
Yeah. And was there anything else today?
No, that was it. So just plenty of fluids.
Yes.
Right.
Painkillers? Have you tried some painkillers?
I haven't, no, because I just find that sort of stuff doesn't really touch the sides, if I'm honest.
Yeah,
So.
I mean, it's entirely up to you, but lots of other people would take
Yeah.
Paracetamol or ibuprofen, or even gargling with aspirin, some people find helpful.
Yeah.
Because it's kind of anti-inflammatory on the actual throat problem.
Okay.
But you don't have to take anything.
Yeah. Okay. All right, no, that's fine.
Great.
Lovely, thank you.
Is it raining still?
It stopped. Stay that way.
All right then.
Thanks.
Bye.
Where are we waving to?
I'm not allowed to wave?
No.
Is it against the practice, the surgery rules? Yeah, OK. I'll remember that for next time. No waving, no smiling, no laughing.
Absolutely, yes.
And only compliment the reception staff.
Absolutely.
How you doing anyway?
Oh, just tickety-boo.
Right, so I'm Dr. McLaren. Nice to meet you.
Yeah, I've managed to slip in the bath, which aggravated my shoulder. And then I was looking out the window and it cracked. And I couldn't move. I was in so much pain. And today it just feels unbelievably tender.
Did you land on your shoulder? Did you land on your hand?
I kind of landed there.
Okay.
But it wasn't too painful.
And then subsequently, this pain just started abruptly when you were doing nothing, and since then it's been really painful. Have you tried any painkillers? Or...
I did yesterday, aspirin and codeine, but I can't really take codeine at work.
What is work for you?
I'm an apprentice plumber,
Okay.
so I need my marbles around me.
Okay. Is there anything that you were worried you might have done, or...
I'm paranoid it's a rotator cuff because it will take ages to heal. Hopefully you're going to tell me that it's something lovely.
Okay, like...
Something that will heal in a couple of weeks.
Okay. Well, let's take a look at it to start with.
Yep.
Easier for me with you stood up.
Stood up.
Now turn and face me. Okay. I want you to bring your arms slowly up. Touch at the top.
I don't want to.
You stop as soon as it's uncomfortable. So at what stage did that become uncomfortable?
When I grunted.
So...
Can I put them down?
Put them down. If you were to do the same forwards...
That's fine.
That's easy. And right the way to the top?
Yeah.
Easy.
Oh, ow, that's
right
new.
at the top.
Yeah.
Across there, that looks like it's quite uncomfortable.
It's not nice, but it doesn't hurt anywhere near as much as when my hand was up.
So you mentioned rotator cuff. It's not entirely typical of that, but I'm not going to be able to say with complete certainty that that's not what it is. This is your shoulder. Your rotator cuff is muscles which support the shoulder, which go over the top of the ball of your shoulder, around the front, around the back. The other thing that you have is ligaments and tendons holding the other structures together. You're quite tender around where your shoulder blade joins your clavicle.
Yep.
And really quite tender when you had to do that movement forwards, which is putting stress around this area, which makes me think it's probably a soft tissue injury to this area rather than your rotator cuff.
That's cool.
I think either way, I would expect with avoiding heavy lifting.
Like lifting radiators and...
Yeah, exactly.
OK.
Taking ibuprofen regularly. Things should start to improve, certainly over the next couple of weeks. And if you're not making any progress, come back and see us. OK?
Right. Thank you very much. Hi, can I help?
I want to make an appointment for Dr. Edge next.
Just the next possible appointment.
Yeah. Is your mum a doctor?
Yeah.
You look so like that.
I know, I hear that a lot.
Lovely.
Hello. Hiya. I did bring my mum down before to have a little test for dementia, and she passed. She's a bit forgetful. Like, things will come out not quite in a proper sentence. Like, words would be the wrong way round then.
Yeah.
She can get quite argumentative as well, which I know is another sign. If it is the early stages of dementia, I would like to know if she can possibly start taking the tablet that prevents it from coming.
OK. We're quite a long way off that, OK? We'd have to make a diagnosis first, and there's certain things that we'd have to do, but we certainly talk about it.
Yeah.
We'll talk about that now. Is that all right? How long ago was it that you brought her down and she had the test for which she passed?
About a year,
About a year. OK. Do you think that you've got worse since then?
No, not really.
Do you?
Yeah, but not really bad.
You're living on your own? OK. To get a diagnosis of dementia, we ask lots of questions, but lots of us get a little bit forgetful.
Yeah.
But are you functioning OK? For example, are you managing your own money and your shopping and all that kind of thing? Yeah. Functioning fine?
Yeah.
So the geriatricians, the elderly experts, would actually say that you need to have both the sort of forgetfulness and all that sort of thing and what we call a functional problems.
Right, OK.
Like not being able to do stuff. OK? Yeah. But let me just find the previous...
But he was adamant I was all right. Wasn't he?
Yeah. Yeah, which is good. You think I'm coming down and I want you to have dementia. I don't. I want it to be stopped if you have got it coming.
Can I help you? Oh, sorry, my lovely. Yeah, it's just really busy, I'm afraid.
I'm sitting in there and I've seen it so packed.
Are you running really late?
Yeah, I am, sorry. You can come to the duty doctor surgery at 11:30. I'm sorry.
It's a week on it.
Yeah.
I'll be back in 2 minutes.
What a day it's been. Have you been busy? Oh, yeah, manic.
Thank you for waiting. I've had a few urgent things going on.
Yeah, you can't be dealt with.
God, it's only 5:10. I feel like it should be 6:10.
Thank you for waiting. It's all right. It's busy. It's always busy.
All right, let's do that same questionnaire again. OK, first thing I'm going to do is I'm going to give you an address. I want you to say it back to me, and then I want you to try and remember it, and I'm going to ask you again in a bit.
To confuse me.
The name and address I'm going to give you is John Brown, 42 West Street, Kensington. Could you repeat that?
John Brown, 42 West Street, Kensington.
OK. Can you tell me the date today?
7th, I believe.
The year?
70.
Excellent. Can you tell me something that's going on in the news at the moment?
Oh, the fighting, the shooting and that, you mean?
What do you mean exactly?
Well...
Who's doing it, Mum?
Oh, sorry, ISIS.
OK. All right, that's fine. Can you remember that name and address for me now?
John Brown, West Street, Kensington.
What number?
Oh, I didn't hear a number. Did you give one? I'm sorry. I didn't hear the number.
I didn't hear the number. OK, you clearly remembered it. That's fine. All right. She's not going to fail this. OK, now I'm going to ask you a couple of things, all right?
Yeah.
Compare now to a few years ago. Is she having more trouble remembering stuff that happened recently, like the news and stuff?
No, not the news, per se, but she might put her glasses down and she can't find them.
Find them, all right. Does she forget what you've said to her?
Sometimes, yeah.
OK. Trouble with financial?
No.
Pain? No, OK. Manages her medicines?
Yep. Yeah.
I don't think there's any sign here.
That's fantastic.
OK?
Yeah, that's
all
brilliant.
right.
Yeah.
So now I can cuss her, can't I?
Yeah, you can tell her.
You keep telling me off now, yeah. No, but it's only because I work with people with dementia. To me, it's like I see little things.
OK, well, let's keep an eye and you can ask me. But, I mean, so many people get that thing about putting the glasses, you know, I mean...
Easy done, isn't it?
Yeah, no, yeah, but she wasn't like that before, do you know what I mean? It might just be old age.
It's just age.
Yeah.
Yeah, I'm sensitive.
I would rather my mum, you know, got old gracefully rather than ending up...
OK. I'm not going to say anything about that.
Nice to see you after so long, though.
Nice to see you, yes.
Yeah.
All right. OK.
Thank you.
All right,
Bye.
OK. All right, then. OK. Yeah.
Sorry, my key's on the floor.
Oh, well, that's no good. No, I won't be testing you for your forgetfulness.
Thanks,
all right, OK, bye-bye.
How can I help?
My son is here, but I can't find him.
What's his date of birth?
Oh, now you're asking. 17 of the 3rd. 02, I think it is. No, it's 23rd, isn't it?
23rd of March.
His sister's 17th.
OK.
Right, what can I do for you?
Well, I came Friday.
Right.
Because I've been a blob in my eye.
Yeah.
And I went to the eye hospital and he's told me that I've had a stroke.
Right.
My eye aches and my head aches all the time. And I think it's affected my hearing as well, because I hardly hear anything.
Yeah. So how do you feel about what they said?
Well, I was a little bit shocked.
Yeah.
But he said they're referring me to the stroke clinic.
Right, OK. Have you heard from them yet?
Nothing, no.
No. I'll try and chase that up. We'll have a little look at you and then I'll see if I can get through to the stroke clinic now. Because you need some blood tests and a full assessment. How long did the problem with the eye last for?
I've still got it.
You've still got it, yeah. OK. Your blood pressure's good, so that's good. Can I just have a little listen to your heart? OK, sometimes it can be an irregular pulse that can cause a clot to travel around and cause the stroke, but at the moment it's nice and regular. Deep breath and out and hold it there. That's fine, OK. Right, so they'll arrange a CT scan in the stroke clinic, OK, to assess your head. What we want to do is reduce your risk of having this again, OK, and try and work out why you had it this time. Do you smoke at all?
Yeah, but I've cut down since.
OK, how much do you normally smoke?
Well, about 10 or 12.
OK, you need to stop.
Yeah.
Yeah? This is a warning.
Yeah.
And luckily, you're good. Yeah? But it could kill you. Yeah. Or paralyse you, stuck in a bed at a young age.
OK, what can I do for you?
So, just today, I've had this rash kind of appear. It's quite bumpy.
So, any of these tattoos new?
No, these are
sometimes
all...
you get
these
reactions
are all,
to tattoos, so...
10 years old.
I agree. It is a little bit lumpy, bumpy skin, isn't it?
And it's just been quite...
But it's interesting because you're lumpy, bumpy in the area of the blue. Actually, let's just look under, get under some magnification. So, this, I mean, it looks very much like this is some of an allergic response to the ink in the skin, and we do see this from time to time. And usually it's when somebody's had, you know, a new tattoo or something that's caused it to flare up, but that's not the case with you.
No.
In terms of what we do with this, if it's really troubling you, a mild steroid cream will probably settle it down.
That's good. It just puts my mind at rest. And
so you used to work in one of the churches, is that right?
No, I work in Southmead at the Southmead Development Trust, which is a charity.
Going well?
Yeah, very well. I mean, we're trying.
And last time you came here, you did talk to Dr. Wardock about a vasectomy, did you?
Yes. I think we're ready to take that to the next step.
You are ready, or
we are ready. Having talked about it. So
OK.
I need to. What is the next step for that?
Well, the next step is one of us needs to write a letter, actually, basically, and get you seen. You've got 2 kids? Both in good health?
We've got 2, yeah.
Both in good health?
Oh, yeah, absolutely fine, yeah.
Your wife wants to go ahead with this?
Very lively, yeah, she does. You know, part of the reason is that we've tried pretty much all the other kind of long-term contraception things, and they've all just been, you know, had side effects and just been a bit unpleasant, so...
Richard gave you a leaflet with all the information?
He did, yeah, I read that, looked for all that. Yeah, that was
so it's your call. I mean, we don't need to deal with it today, but if you
if we can write the letter...
I can write a letter and get you in the system?
That'd be great.
Fine.
Excellent.
OK, and then the next thing you know is that you'll get a letter with an appointment to go.
Yeah, that'd be fantastic.
To have it done?
Yeah.
Take it from there.
Yeah,
OK.
that'd be fantastic.
Looks like Richard's giving you the chat ready.
He has, yeah.
OK, I'll get that done.
Thank you very much.
You sure I'm not pushing you into...
No, absolutely. No, honestly.
I saw that was the last thing. It looked like you'd been left hanging.
No, we talked about it. We thought about it for quite a long time and then kind of just... I think that might have even been before Christmas.
I'll give you a 2-day cooling off period, OK? I'll write a letter next week if I haven't heard back.
That'd be fantastic.
All right?
OK, great.
OK,
thank you very much.
Bye.
You all right? Your pain in your head?
Yeah, it's all there.
OK.
In the backs of my eyes.
I'll see if I can get through to the stroke clinic now. Oh, hi, I wonder if you could help me. I've got a patient with me who presented to us on Friday with eye symptoms, loss of central vision, and she was referred to the eye hospital. I mean, she needs to be seen today, really, doesn't she, if she's got ongoing symptoms? So shall I wait to do anything until you ring me back? Right, she's just going to check with the consultant.
I got a pain in this eye, and I'm worried to death I'm going to get another blob.
What's the one thing you can do?
Stop smoking.
Yeah. From now?
Yeah.
Yeah. Because that's the biggest risk.
Yeah. What causes blood clots, Sam?
So, as I said, one of the commonest ones are an irregular pulse. Another one is narrowing of arteries in the neck. That can throw off a little clot, and that can go to the brain as well. So what they'll probably do at some point is arrange a monitor to monitor your pulse over a week or so to check to see if that happens. And also they'll probably scan your neck to check there's no sign of any blockage there as well. Okay, and they'll probably arrange a CT scan or an MRI of your head as well. Yeah. Okay. A stroke is potentially life-threatening, so it's very important to act quickly if anybody's got the symptoms of a stroke. A way of identifying that is by using the word fast. So the F is for the face, if there's any facial drooping. A is for the arms. Can people raise the arms above the head? S is for slurred speech. And T is for time, acting quickly by calling 999. Hello, Amanda Ramshaw. But as she's got ongoing symptoms, I'm concerned, to be honest. Just thought the guidelines say that we need to send people in. But yeah, so the options are we either send you to the emergency department today, or we can arrange for it to be seen in clinic tomorrow by the stroke consultant.
Yeah, I'll go tomorrow.
You'll go tomorrow, is it? OK, all right. Yep, she says she'd rather do that tomorrow. OK, bye-bye. Right, OK. So I'll send this off now. It says all patients should have 300 milligrams of aspirin, OK?
Right.
And you mustn't drive.
Right, OK.
If you don't hear anything by lunchtime tomorrow, let us know.
OK.
All right.
Yeah, thank you very much.
If you want to make an appointment for the smoking clinic, please do.
OK.
All right. OK, good luck.
Thank you.
Bye-bye.
Bye.
Right, my love. Take care. Bye.
Come on through. Hello.
Hiya.
Come on in, come and take a seat. I'm Dr. Ahmed. So, Murath, you had a accident. You were knocked off your bike. Did you go to A&E when that happened?
I went to A&E, and after A&E, we came here.
Yes, you saw Dr. Pelly. You had cocodamol and naproxen given because you've got a dislocated little finger.
This is not the problem while you were down there.
OK, that's all right. I just want to get the background first as well. And what's happening now with the finger or with the plastics team?
Finger is same. I got pain on my shoulder, really pain. And since Sunday, I haven't been eating. So I haven't been eating nothing. That's
nothing down since Monday.
Yeah. Then when I go to toilet, it's just water comes out.
OK.
And I have really bad pain in my spine here.
In your lower back?
Since the accident happened, my body changed. I don't know what happened.
How did you come off your bike?
The 26-ton of truck hit me off my bike. I nearly died. I nearly went underneath.
But you didn't hit your stomach or anything like that?
Last week.
So it was a close thing.
But someone said I might lose my belly button because I was so frightened. Belly button moved.
You listened to too many stories.
OK.
I talked to my mum back home in Turkey. That's what she said. But yesterday, someone told me if you puking up, you could have stomach cancer. That makes me worry more.
Bless you.
No, don't. It's an allergic thing.
Oh, right. He's got a small allergy to dust mites, so that does make his breathing bad sometimes.
I'm allergic to penicillin.
Won't give you that.
Plasters, wool. I'm allergic to a lot of...
Wool?
Yeah. What? I don't know, I've got really sensitive skin, so wool makes me come up in a rash. Some shampoos make me just...
It's the ginger gene.
It is.
I'm a closet ginger as well.
Can we be allergic to tea?
I wouldn't have thought that would be a reason.
How are things going with your breathing then? How are you
At the moment, things are good.
Yeah. Did you do the primary rehab then in March, it says here?
I went along to the actual appointment. My blood pressure was so high. I mean, I did warn them that I'd been kicked out of gyms before because of my blood pressure being so high.
Right.
And it's not that. I had a reaction to the sulfites. I mean, sulfites are the worst to give me.
Right.
And I don't care what anyone says. I am allergic to them. I mean, the alcohol, it's the sodium methoxysulfite in it, which is a confirmed allergy with me. They sterilise the equipment. And that is what I'm reacting to in the alcohol. And they put it in eye drops, ear drops. I mean, it's like I have no access to any pain relief because if I'm in pain, they tell me to take paracetamol, which contains sodium methoxysulfite sulfite. So I have no pain relief, which is why I kick off so much.
So you're only taking the one inhaler then?
Yeah.
So
I can't tolerate the lactose if you have any more than that.
Okay.
Because I'm lactose intolerant.
Yeah, saw that one. But you haven't had to have any oral steroids in the last year?
Well, the last time they gave me steroids, they shut my lungs down. And that's the maize starch in it. And with the maize starch, when the manufacturers manufacture it, they put sulfite in it.
Right, let's do your blood pressure. (146/82).
Good, it's back down again.
So, I'll get this ready, and you remember how to use this? Blow, but then you keep... Right, when you're ready, a nice big breath. Well done, take a seat a minute. Let me write it all down. Let's have a look. Yeah, so we don't need to change anything. Right, but I will refer you to the pulmonary rehab. So that's our plan. Is that all right?
Yep, that's fine. That's fine by me.
Lovely. And I'll see you hopefully in a year's time.
OK, I'll see you in a year's time. Bye.
Bye.
Someone told me if you puking up, you could have stomach cancer.
That's made you very worried about it. OK. So let's check you over. OK. And do you feel sick in between these vomiting episodes?
Yeah,
as if...
I feel sick.
I know he's quite poorly because he can't even smoke a whole cigarette.
There's always some good thing out of a bad thing. Are you able to just lie down on the couch?
Yeah.
OK.
There.
There's generally a bit all over, isn't it?
Yeah.
Yeah? OK, come and take a seat. So, look, I'm sorry that you had this accident from your bike, but
I think it's separate.
It could have been a lot worse.
Yeah.
This is a separate issue, you're right. I mean, I think you've got a bit of... there's a lot of it going around, actually, this week. There's a viral gastroenteritis or a bug that's causing a bit of sickness, a bit of vomiting, a bit of loose poos. So we can give some tablets to help with the gripey pains and just drink fluids, but I would stop the naproxen. It probably aggravates...
I don't have cancer or nothing.
No.
There's no symptoms of any cancer.
OK.
OK. If anything gets worse, you know where we are, or changes, but this should settle things.
Well,
I'll give you that. All right?
Thank you very much.
That's all right. Take care for now.
Thank you.
Right, how can I help you?
Can I have some batteries?
Oh, is that what you wanted? I could do that. Easy. 1 or 2 hearing aids, Mr. Dunn?
3.
3. And one in the middle.
What can we do for you today?
Well, it's my ears, doctor. For some months now, I've been getting like a buzzing. And a couple of weeks ago, I went all strange. I nearly passed out and I was sick. And then yesterday, the buzzing in my ear was so horrendous, it was awful. It was like it was full up with something, you know, sort of like blocked.
Have you noticed any difficulty in hearing?
I did yesterday. I could hardly hear anything yesterday.
But you're not having difficulty hearing me?
No, no.
And if I lower my voice, you can still hear me? When people get buzzing in the ear, it drives them mad.
Last night it did.
Kept you awake?
Did last night. I went to bed. I find that I've got noise going on in the house all day because then that takes it away. I've got the telly going.
That's very interesting. You've hit on the solution, almost.
Oh, right.
Have you ever been exposed to loud noise? Never worked in a very noisy environment?
Dry cleaners is about as noisy as it gets.
You're not addicted to going to awful loud concerts?
No, nothing like that.
All right.
No. A bit old for that now.
Okay. Tell me if I hurt you. Well, your ears are as clean as a whistle, I tell you don't need them syringing. That isn't the problem, whatever the problem is. Same with that one. Very good. Tuning fork. Can you hear that? If I put it there, can you hear it?
Yeah.
Good. Same thing. You hear that?
Yeah.
A bit louder there or there?
There.
Good. That's how it should be. What I'm going to do is call out some numbers to you. Just call them back.
Okay.
So if you put a finger in one ear, all right? 62.
62.
32.
32.
Thank you. Other ear. 78.
78.
14.
14.
That's fine. I can't find anything wrong with your ears. But, you know, you don't get the buzzing for no reason whatsoever.
No.
If things change, then we should see you again and do something about it.
You've disappointed my children now, you know that, don't you?
Because?
They think I'm all gone deaf.
How do they know? How do they know? We've proved you're not going deaf.
Oh, Mum's going deaf. They
don't want you to. Well, yeah, they want to get you to age before your time. All right.
Right. Oh. Thank you very much, Doctor.
Good. Bye-bye.
Nice to meet you. Bye.
Nice to see you. You gonna give me a wave? See you later. Goodbye.
All right,
Cheers
thank
then.
you.
Bye.
Right, that's lovely.
Very good.
Thank
nice
you.
to see you, Tracy.
Okay.
See you in 2 years.
Yeah,
Or
probably.
sooner.
Yeah. Bye-bye.
Take care for now.
Thank you very much.
That's all right.
Have a nice evening.
Thanks. Bye-bye.
Bye-bye.